Yeah. And now you click on go into the presenter tab. Yep, that's okay. Presenter tab and my
Presenter's laptop sound check. Clerk's laptop sound check.
You're live, Counselor? Okay, bear with us for one moment. We've just lost Counselor Clark in WebEx, so we're going to just delay this start really quick. No, you can leave it running. We're just going to help him
Okay,
first.
I'm
Thank you.
live again. My apologies. I do not know what happened. Let's hope it doesn't happen again. Okay, so we're live now, Madam Clerk?
Yes, through you, Mr. Deputy Mayor, we are live. You are in twice, so I'm going to remove one of
Then
you. That might be your, let's see if we lose you. I hope not. Bear with me just one second. Okay, you might have better now because you were in there twice for some reason. Okay, you're good to go. Thank you.
Thank you. Good morning, everyone. Quorum is present, and I'd like to call the General Issues Committee meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. As well, a reminder that all electronic devices are to be switched to a non-audible function during committee meetings. Members are reminded of the 5-minute time limit, which will be adhered to during this meeting. Members can submit another request to speak if they require additional time to ask questions or make comments, and I will do my very best to time your questions separate from staff answers. Madam Clerk, are there any changes to the agenda?
Yes, through you, Mr. Deputy Mayor, we have two added delegation requests. The first one is from Ty Thaismeyer, the head of Natural Areas, Royal Botanical Gardens, respecting item 10.6, report PW 19008N, the Shadot Creek order update, and that would be for today's meeting. The second request that you will see on the screen is Chris McLaughlin, and he has since withdrawn his request for today. Added discussion items 10.7, the Advisory Committee for Persons with Disabilities Report 21013 from December the 14th, 2021. 10.8, amendment to the mandatory COVID-19 vaccination verification policy, HUR 21008A. Two amendments to the outstanding business list, two items to be removed, the potential solutions to the Shadot Creek matter, and that is item 10.6 on today's agenda, and the Mayor's Task Force on Economic Recovery, as that is being addressed in item 7.1 on today's agenda. And lastly, we have a private and confidential edition, item 14.2, amendments to the city's mandatory vaccine verification policy report LS 22008. And that is all.
Thank you very much. Is there any discussion regarding the amendments to the agenda? And I'm seeing nothing on my screen. And Matt, you don't have anything? Okay, so we will proceed with the vote, please. I need a mover and a seconder to approve the agenda as amended. I'm sorry, I see Councillor Pearson and Mayor Eisenberger. Thank you. Sorry, folks, I have to toggle back and forth because my computer kind of went wonky. And the vote should be up.
Thank you, Councillor Powers.
And that vote carried. Thank you, unanimously. We're moving on to approval of the minutes. Item 4.1 and 4.2, December the 8th and December. Have a mover and a seconder to put the minutes of December the 8th and 10th on the floor at the same time. Moved by Councillor Partridge, seconded by Councillor Pearson. Any questions or concerns about the minutes? Seeing none, we'll go to the vote, please. The vote is up. And that carried also. A delegation request. May I please have a to put item 6.1 on the floor? And that is moved by Councillor Powers, seconded by Councillor Farr. Any questions or comments with regards to the delegation request? Seeing none, we'll go to the vote, please. and that item carried unanimously as well. Item 7.1 is the Mayor's on Economic Recovery, the update PED 22005 citywide. May I have a mover and a seconder to put the report on the floor? Moved by Mayor Eisenberger, seconded by Councillor Pauls. The item is now on the floor, and Mr. Mayor, I understand that you have an amendment.
I do indeed. Thank you. And I assume that we can amend it in the consent items, Stephanie. I know that's the way you set it up, but I presume it'll come to council as a separate matter.
Through you, Mr. Deputy Mayor, consent items still have recommendations in them, as this report does, so it would definitely still come to council the usual way. So your amendment will show as subsections B onward. This report has an A in it already.
Perfect. Okay. All right. Thank you. And I'm pleased to put forward a motion that I shared with members of council, moved by myself and seconded by Councillor Pauls, that regarding the local commercial areas economic recovery program. I'll read you the whereases. It's not too terribly long, but the recommendations are wholesome. But let me just add that whereas many of the city's local commercial areas, including the community downtowns and the city's 13 business improvement areas, have been hard hit by the COVID pandemic. Whereas the report of the Mayor's Task Force on Economic Recovery includes a number of recommendations related to supporting economic recovery by encouraging people to shop local, explore local, visit local business areas, and support local businesses. And whereas the report of the Mayor's Task Force on Economic Recovery includes a number of recommendations related to supporting the city's arts community by providing opportunities for artists to perform or to create and display their work. And whereas the City of Hamilton is committed to supporting local businesses and local artists as one component of its broader economic recovery planning, and whereas City Council approved $2 million in 2021's capital budget and $1 million in the 2022 capital budget for the Economic Development Initiative's capital projects to support economic development, including post-COVID economic recovery. And whereas a number of economic development initiatives to support many of the city's major economic sectors already supported through economic development initiatives capital projects in 2021 and 2022, including the finance, insurance, and real estate sector strategy, the life sciences sector strategy, the advanced manufacturing strategy, and the Bayfront industrial area strategy. And the last whereas, as 2021, the city supported local businesses as part of the implementation of the recommendation of the Mayor's Task Force on Economic Recovery through a number of initiatives, including creating the COVID concierge for business, one-time grants to local businesses improvement areas to support special programming, deferring business license fees increases, waiving fees for the outdoor dining program, and enhancing focus on supporting local tourism and local businesses through Tourism Hamilton and other city social media channels. Therefore, it be resolved, and again, I will read it as quickly as I can, but I think it's worth laying out in full, that the Planning and Economic Development Department staff be directed to implement a local commercial areas economic recovery program for 2022-2023 that would support economic recovery for bringing events, programs, and other animation activities to the city's BIAs, community downtowns, and other commercial areas that encourage the public to visit the commercial areas and to support the local businesses. Item C, that the priority be given to programs and activities that would also generate and engage local artists, including but not limited to artistic performances, artistic programming, and arts installations that draw the public to the commercial areas. Support for the Concrete Canvas Street Art Festival to support local artists to install murals in the city's commercial areas, and funding for BIAs to support street fairs and street festivals through partial offsetting of road closure costs. Item D, that the city support Hamilton's culinary sector by once again waiving city fees in 2022 for the temporary outdoor patio program, including any application fees, fees for temporary road closure permits, traffic safety measures, and parking meter charges. That's citywide. and that 750,000 over 2 years be funded from the Economic Development Initiative's capital project and be allocated to support the local commercial areas economic recovery program, and that the Planning and Economic Development Department staff be directed to seek opportunities to leverage the city's funding with funding from other partners, including provincial and federal government programs. And that the General Manager of Planning and Economic Development be authorized and directed to create a 2-year temporary contract senior project manager position to be funded from the Economic Development Initiative's capital project to lead the local commercial areas economic recovery program. And lastly, that the General Manager of Planning and Economic Development be authorized and directed to enter into the necessary contracts and agreements with any external parties or vendors to implement a local commercial areas economic recovery program for 2022 and 2023 in accordance with the city's procurement policies and in a form satisfactory to the city's solicitor. Sorry for the long-winded preamble. I think it's important enough to get a full understanding of what this means in our broader community. And if I might, Mr. Chair, just have a brief word on what this all means and where we're at. Clearly, we're in a fourth wave, and clearly the impacts of shutdowns are facing, important key businesses in our community once again. Not all, some some capacity limits have been set for other businesses, but certainly specifically in the restaurant sector and in many other areas, continues to be challenges that I think the city has a role to play, as we have in the past, to help us through. The expectation on this fourth wave is hopefully that sometime in January, February, we will see some easing, hopefully, based on some of the COVID updates we heard at the Board of Health on Monday. But that doesn't mean that, our businesses and other areas are out of the woods. And so we've had a practice of providing kind of focused help for our BIAs, and I think that captures many of our businesses that are struggling. There are many other supports that the province has announced recently to support other businesses as well. And of course, the restaurant sector, once again, or the hospitality sector, in fact, the entire sector, another area that has once again been exceptionally hard hit for ostensibly the right reasons to curb the spread of this virus, and certainly that's a noble cause, but it has its impacts, and surely we need to take measures to try and be as helpful as we can with the resources we have to help these businesses along. So this is one additional thing that we can do over and above what's already in the mayor's task force recommendations that combines both the just recovery aspects of it as well as the task force aspects of it, and certainly provides the status of where all of those issues are, and our commitment to helping our community to the best degree possible. So I'm pleased to have our chair of the BIA's Association, Councillor Pauls, second this, and I know that this will be well received, certainly in the BIAs and in the restaurant and hospitality sector, and certainly ask you for your support so that we can continue to provide that level of support as needed in 2022, 2023. And clearly, economic recovery from all of the work that we've done over the last couple of years is going to be more than a one-year adventure. But this is something that we can do in this coming year that I'm sure will make a difference for the businesses impacted in the restaurants and hospitality sector. So thank you for my long-winded preamble, whereases and motion, but I think it is well explained, and I would hope that Councillor Pauls might want to speak to how the BIAs might respond to this as well as her role as chair of the BIAs Association. But I have no doubt that it'll be well received.
Thank you, Mr. Mayor. We appreciate you reading the resolution in full and your comments. Councillor Pauls, you are up now.
Thank you. I really want to thank the mayor and the force task, and you know who you are, for bringing this. But I want to highlight one of the event, the Hamilton Day campaign in support of shopping local. It was held November 20th, 21. And I had a meeting yesterday with the BIAs, and they all said what a success it was for them all to bring people to stay in Hamilton, to shop in their BIAs where they live, and they were very appreciative. And I told them that the city has concern about the shutdowns, but we must do it because of our safety. But they're also concerned about their livelihood and all the BIAs. So I told them we have their back. I told them that this task force that the mayor and the committee has put together is amazing. So, Mayor, thank you. Thank you. When you called me and said that you were going to put this amendment, I was so thrilled. And I assured all of them yesterday that good things are going to happen, and we, the city, support local business because really it's them that hire people. They live in our city. We want Hamilton to grow with our small business. As you all know, I had a small business and we work hard. And we love working, and I love being with the BIAs and talking about ideas, what we can do. So thank you again, Mayor and the task force. Thank you.
Thank you, councillors. Is there any other comments from anybody else? Councillor Partridge, please, and then Councillor Wilson.
Yes, thank you, Deputy Mayor Clark. And I'm very supportive of this motion and thank everyone who was involved and thank the mayor and Councillor Pauls for bringing it forward. I just have a couple of questions. Is this funding going to be available to those who are applying to the City Enrichment Fund?
Thank you. Mr. Zagaric, are you there?
So through you, Mr.
Mr.
Chair,
Thorne?
I can start, and then Mr. Zarigar can add to it if he wishes. Jason Thorne, General Manager of Planning and Economic Development. So in terms of the programs that are identified in the motions, this would not be necessarily direct grant to individual nonprofits who might be applying through some of those city enrichment programs. Where I do see there potentially being some additional support, if you look at some of the street fairs and festivals that are organized in some of these areas, what we've heard through the BIAs is one of the costs that they can do their sponsorships and fundraising to cover some of the costs. It's really the city fees. So the city charges a fee for some of the closure permits. The city charges fees for some of the Book 7 traffic measures to make sure that the area is safe. Those are the types of things that the motion is speaking to. Similarly, with the outdoor dining, the businesses themselves are still responsible for their own costs. They have to build patios, they have to buy patio furniture, all that sort of thing. This really relates to the waiving of the city fees that apply to those.
Yeah, and thank you very much, General Manager Thorne. I really, that was for the benefit of those who are watching, because there's quite a bit of interest about that around this as well. So just to clarify, the funding will be delivered through the BIA, or can individual charitable organizations only come through and apply for this, please?
Thank you. Mr. Thorne?
Yeah, so through the chair, what we'd be looking at is actually having some city-led and city-coordinated programming. So if you take, for example, one of the things we've been looking at is our Music Mondays program. So Music Mondays for the past couple of years is an event that the city has hosted and organized at City Hall, looking to bring that into some of the BIA areas. So again, it's city programming, but it starts to drive some of the public to go to the BIAs to enjoy these events and hopefully support the local businesses while they're there. So it's not an application grant program for individual nonprofits, which I think is what the councillor is asking in terms of we already have a program through the City Enrichment Fund for that type of thing. This is really about having some city-led programming and city-led support for some of the events and activities that will happen in these commercial areas. Again, all kind of aimed at helping people to just get back to these commercial areas, come back into the local areas and support the businesses that are there.
Thank you, Councillor.
Yeah, thank you very much, Deputy Mayor. And so just to clarify, so this is only for city-run events, and it's for the exemption for fees related to that, including road closures. So it's not for the BIAs to distribute or to fund their events. It's for city-driven events. Am I explaining that okay?
Mr. Thorne? Mr.
Yeah,
Thorne?
so it's not looking to set up a sort of a parallel grant program. It's looking to offset some of the city costs. So again, the most best example I can think of is around things like the BIA is doing some of their street closures, and they've come to us a few times and said, one of the costs they bump into is just the fees that we charge. So we'd be able to waive those sorts of fees. It's not an application-based program where they seek a grant to run an event, but where we can reduce some of the city costs, that's what we'd be looking at through what's directed in this motion.
So again, just to clarify, it could be a BIA event, or does it have to be a city-run event? I just
sorry,
need
yes,
some
through the chair. Yes,
clarity
it could
on
be a
there.
BI event. So for example, many of the BIAs already have run events. Concession has their music on the street event. Lock does their Saturday, 7 Saturdays, I think they call it. So those are events that are run by the BIAs, but to run them, they do have to pay certain city fees. And so we'd be looking to waive those city fees.
Councillor.
Oh, okay. So that would not apply to something like the Flamborough Santa Claus Parade that has to do road closures that the BIA supports. It wouldn't include the Village Theatre, because all these arts organizations and the Santa Claus Parade does have a lot of artists involved in it. I'm just want to make sure for clarity that it is city-run events or BIA events that are run by the BIA. Does that pretty much capture it?
Through the
Mr.
chair,
Thorne.
it does, and we do have to, the motion sort of just sets us on a path of designing what this program would look like. But yes, that is the intention, and the intention really is to support the idea here is to support the commercial areas and to bring activity back into those commercial areas.
Okay, and I appreciate that. Thank you, Deputy Mayor. I will meet with our BIA. I'm on the BIA board in Waterdown. I don't believe there's a lot of city-run events that happen within Waterdown, and I could be completely wrong, but certainly if there's opportunity to bring more citywide events up to the Waterdown BIA, I think that's where the win-win could be here. Thank you very much, sir. I appreciate the time.
Thank you, Councillor Partridge. The next speaker is Councillor Wilson, please.
Thank you very much, Chair. I'm very appreciative of this motion, and just further to Councillor Partridge's good questions on clarification, I just speak to the experience of, we have 2 very active BIAs in Ward 1, Westdale BIA, Lock Street BIA. They work really well together, but they have different needs in terms of their street activity. Lock Street, GM Thorne mentioned the Book 7 traffic measures. Those costs, those are the costs you incur when you are having to get the infrastructure in place to close a public space. Those costs have jumped significantly, and it was actually an obstacle for the Lock Street BIA to do its 7 Sundays or 7 Saturdays, beg your pardon. And there wasn't any money to assist in offsetting them. And in the absence of, frankly, Ward 1 taxpayers coming forward, that event wouldn't have taken place. So my question, and I think that event was enjoyed certainly by the neighborhood, but from what I understand and what their surveys told them, it was enjoyed by residents across this city and beyond, people who during COVID have wanted to get out and at least see people. So my question with respect to C in the motion, the partial offsetting of road closures, um, are you able to give any more detail on have we defined what partial might be to GM Thorne?
Thank you. Mr. Thorne, please.
So through the chair, no, we haven't. You've identified what some of those costs are. If this motion is approved, we'd have to reach out to the BIAs who do these types of programs and get a sense of what those costs are. That the motion indicates partial because it's not necessarily full costs. I know some of those costs can become significant, transit detour costs, things like that. So we'd have to have a conversation with the BIAs to understand what would be an appropriate level of city offsetting to support those events.
Thank you very much.
Councillor Wilson.
Oh, thank you very much, GM Thorne. Yes, just the costs are significant and they're only rising. My understanding is for reasons of we were all becoming a little bit more litigious, I believe. So I'm happy to see this. I know the Westdale and the Lock Street BIA are in grave need of this. And I think our communities are only stronger because of a vibrant local business areas. So thank you, Mr. Mayor, and thank you, Councillor Pauls, for your work with the BIAs and all you do. Thank you.
Thank you, Councillor. Our next speaker is Councillor Tom Jackson, please.
Good morning, Deputy Mayor Clark.
Good morning.
Thank you for the motion, which I'm supportive of. Couple of questions further through you to General Manager Thorne. In the D part of the motion, General Manager, it talks about waiving of the fees. As you know, again, it seems to be, this motion seems to be BIA oriented. And across the entire mountain of 160,000 people approximately, we have thousands of businesses, but only one official BIA on the mountain on concession. So again, I just need to have that reaffirmed that the D part, waiving of fees, etc., is not just BIA oriented. Through you, Deputy Mayor, please.
Thank you, Mr. Thorne.
Yeah, so through the chair, Part D speaks to the waiving of the fees for the outdoor dining, and yes, that's citywide. And I can't give you the exact percentage, but I would say in 2021, most of the participating businesses were actually outside of BIAs. So yes, it would continue to apply to them.
Thank you. And staying with that D part paragraph, the adjective temporary that's in there, General Manager Thorne, is my memory flawed, or I thought in the last few months, ending last year, I thought we made it a permanent program, the outdoor uh, patios availability and waiving of fees. Did I miss something? I thought that word temporary was replaced with permanent. That's my last question, Deputy Mayor Clark. Through you, please.
Thank you, Councillor. Director?
Yes, so through the chair, staff was directed to bring back a report to make that program permanent. We are finalizing that report. I hope to have it in front of council at the end of February. It will be a permanent program for temporary patios. So the patios themselves still have to be temporarily, but the program that allows them would be a permanent program. So the title of it may get a little bit confusing, but yes, the idea is to make it a permanent program for every year businesses to be able to do these temporary patios.
Thank you for
Councillor Jackson.
confirming. Thank you for confirming, General Manager Thorne. That's still forthcoming, and I got the hybridness of your explanation. Thanks, Deputy Mayor Clark.
Thank you, Councillor. Any further speakers? Councillor Wilson?
Thank you, thank you, Deputy Mayor. Just for my colleagues, I was able to check my notes, and for the road closure of Lock, it was just under 30,000. So for small businesses, it's a huge amount of money in order to activate those streets and in order to try and provide a lifeline to both small retail and small restaurants. So it's a significant cost. It's a regrettable cost, but it's very real. Thank you.
Thank you, Councillor. Any further comments or questions? Seeing none, we'll go to the electronic vote on the mayor's amendment. Please move by the mayor, seconded by Councillor Pauls. The vote's up.
Councillor Pearson, are you able to vote? Thank you.
And that vote carried. And now we, same mover and seconder for the motion as amended on the main document. And that vote carried unanimously also. Madam Clerk, I don't think I ever asked for declarations this morning. I think I paused over number 3. So I'll just reconfirm, are there any declarations of interest this morning? No, I don't see any. Perfect. Thank you very much. My apologies for the oversight. 7.2 is the Dundas Business Improvement Area Revised Board of Management. I need a mover and a seconder to put the report on the floor. Moved by Councillor Vanderbeek and seconded by Councillor Partridge. Any questions or comments with regards to item 7.2? Seeing none, Madam Clerk, we will have the vote now, please. Vote is up. And that vote carried unanimously. I need to move put item 7.3, the Ancaster Village Business Improvement Area Revised Board of Management, on the floor. Moved by Councillor Pauls and seconded by Mayor Eisenberger. Any comments or questions? Seeing none, we'll move to the vote, please. Votes up. And that vote carried 13 to nothing, unanimous. We're moving on to item 8, which is the sorry, Madam Clerk. Did I miss
Sorry,
something
Councillor
again?
Pearson. Councillor Pearson was
I'm
waiting.
sorry. I don't know why my vote's taking so long to come through. By the time you said it carried, it just came up on my screen. I am in favor on that one, Stephanie, if you can.
I did get you from this end.
Isn't that weird? Okay, that is a very
Thank you.
slow time delay today. Thank you.
That's because there's a slow chair. 8.1, COVID verbal update. Jason Thorne, General Manager of Planning and Economic Development and the Director of the Emergency Operations Center, and Dr. Elizabeth Richardson, Medical Officer Health, will provide the update regarding COVID-19.
Thank you very much, Mr. Chair. And I will begin, and then I'll turn things over to Dr. Richardson to add. I just have a few updates for Council this morning, and as usual, there are a number of staff here as well who can respond to questions if Council has any questions. So as I noted in the last update, the province has announced that we are back in step 2 of the province's roadmap to reopen. That took effect last Wednesday, and it includes a number of enhanced measures as well as restrictions in terms of places that are allowed to open and operate. There is a full list of the services that are required to close up on the city's website. These restrictions are in place until at least 21 days, which would take us to January the 26th. The move to step 2 did affect some of our city services, most notably in recreation, where we have closed our recreation centers, including our arenas and also our recreation programs for the winter season, which were scheduled to have begun this week, have been canceled. We are giving credits to those members of the public who had paid for some of these programs. Those are being processed automatically, although members of the public can reach out to recreation staff if they have any questions. Outdoor rinks do remain open, although the provincial rules require them to open at 50% capacity. However, they do remain open and they are on a first come, first serve basis. I have an update as well about some of our city services that have been impacted by our current staffing levels, whether through staff absence due to illness or redeployments. So we continue to work very closely with Hamilton Public Health as well as our healthcare partners to scale up the COVID-19 capacity in the city. So that has meant we have, as of the beginning of this week, 245 city staff who've been redeployed directly to support the frontline vaccination clinics. We've also been planning for staff shortages due to the redeployments, but also due to staff isolation or quarantine. As of the beginning of this week, and HR may have some updated numbers, but as of the beginning of this week, we had 176 city employees who'd either tested positive for COVID-19 or were in isolation. Of those, 35 were paramedic staff, though the paramedics have noted that their absentee rates due to illness are slightly higher than normal for this time of year, but not significantly so, and they've been able to maintain their staffing levels. For HSR, HSR has announced a modified schedule that will be taking effect as of January the 23rd until Saturday, April the 30th. While Saturday and Sunday service levels will remain unchanged, there are a select number of routes that will begin operating at a reduced level of service effective January the 23rd. And we are providing updates to the public on our website, as well as through our social media channels as to what those modified schedules are. In long-term care, again, as of the beginning of this week, we had approximately 17% of the staff between Macassa and Wentworth Lodges who were off sick or isolating. But overall, staffing levels are stable, and that's thanks to the support of our casual team members, staff working overtime, as well as a number of city staff who've redeployed to support those lodges. And finally, I'll just say a quick word about bylaw enforcement. That does continue. As the provincial orders changed last week, we did, as we have normally done throughout the pandemic, is we begin with a period of education and raising awareness about those restrictions are prior to doing full enforcement. We did have 14 COVID-related charges laid over the weekend, last weekend. Most of those actually were for face covering violations, which has been a restriction that's been in place for quite some time now. And then we did have 2 businesses as well that were opening against the provincial orders, and charges were laid in those cases. So with that update, I will turn things over to Dr. Richardson. And then, as I said, there are a number of staff who are available to answer any questions.
Thank you, Mr. Thorne. Dr. Richardson, please.
Thank you, Jason. Given the extensive update we did at the Board of Health today, I don't think I really have much to add over that. So I'm just here if there are any questions that you may have.
Thank you so much, Doctor. Much appreciated. Councillor Nan, please. You have the floor.
Thank you, and good morning, Deputy Mayor. And
Morning.
thank you for the overview, GM Thorne. Quick question related to recreation centers that we're serving as warming centers. So with those centers now closed to recreation activities, wondering if those facilities are still available as warming centers during cold alerts, and if so, if we could get an updated list of which of those recreation centers will serve that purpose publicly. Thank you.
Who wishes to tackle that?
Through you, Mr. Chair, I believe either Grace Mader or Chris Hurstick are on the line who could probably respond to that one.
Thank you, sir.
Mr. Deputy Mayor, Chris Hurstick, Director of Recreation. Yes, the warming centers, selected warming centers are open when required. We have staff available to staff those sites. We'd be glad to send those sites over to the council as well. I believe it was in a media release on Monday, but we'll make sure that council gets those sites.
That would be helpful. We had a number of inquiries over that cold alert, and it wasn't available on the website, and residents also suggested that that be updated there as well. Thank you.
Thank you. Councillor Partridge, please.
Yes, thank you, Deputy Mayor. And you know, I hate to ask the question, how many bylaw officers do we actually have that are out and about? Because we, don't want to tip our hat on that. But I just want everybody to be aware. I want to thank bylaw because they certainly trying to cover the entire city is got to be a real challenge for them. I know in Waterdown alone, we have been flooded with complaints about a local dance studio that operates a gym as well as daycare. They have been fully in operation for the past week. They've got 50, 60 children that are coming in every day and no social distancing. They've put postings on Facebook. They are saying they are not going to follow the rules. And we also have a fitness place in Waterdown who has been open from 6:30 in the morning till 8 o'clock at night. Fully people in there jogging, running, doing whatever. And we've provided all kinds of pictures coming in from my residents, and my residents are up in arms about this. So we've been working very closely with bylaw, but if that's just an example coming from a small community that is growing of Waterdown, I can't imagine what is going on across the city. So I just wanted everybody to be aware of that. That's the kind of things that our bylaw department is dealing with. So, I mean, my hat and kudos to them. It certainly can't be easy, especially when you're dealing with confrontational business owners. Thank you. That's all I wanted to say.
Thank you, Councillor, for sharing that viewpoint. Much appreciated. Councillor Tom Jackson.
I feel like I'm on the former Johnny Carson show the way you do that, Deputy Mayor Clark, but thank you. Anyways, General Manager Thorne, I just need to, I know some of my constituents, I told them I'd be asking this and will be listening in this morning. So I need to ask this, please, for their edification. If I could just rewind, Deputy Mayor Clark, the last 2-3 weeks before Step 2 was announced by the Premier, the greater restrictions on closing all rec centers and arenas, and before that and since that, and what the future might be. So General Manager Thorne, I shared with you in the last day or two some emails from some of my constituents, Deputy Mayor Clark, that showed factually before Step 2 was announced over the Christmas holidays that they went to Brantford, they went to Burlington to access recreational facilities that were available and open. And obviously, they were very unhappy and disappointed they had to do that. And as local taxpayers expressed their displeasure as well as to wondering why their own city paid for facilities couldn't have been opened while some other municipalities were. And again, that was prior to step 2. If you or possibly General Manager Mader or Director Chris Herstick could give an explanation on that. Was it redeployment of staff in Hamilton? Whatever the reasons were, possibly. And now that we're in step 2, if it can be confirmed beyond a shadow of a doubt that all municipalities, rec centers are shut down, and when the restrictions, hopefully, thirdly, will hopefully be removed or eased, Deputy Mayor Clark, what are our plans from a recreational standpoint with primarily our rec centers and arenas that people are just desperately needing to get to for physical activity? Through you, Deputy Mayor Clark, it's basically a 3-pronged chronological question, and I kind of primed the General Manager Thorne for that in the last day or two. Please.
Thank you. We'll start with GM Thorne. Nope, can't hear you.
First, I'll unmute, and then I'll start, and then I may ask.
And what you were saying was brilliant.
It was really good. So yes, a couple parts to the councillor's question. So as of right now, yes, the provincial regulations do require all rec centers to close. So that is the case in Hamilton. I would certainly hope it's the case in other municipalities as well, because they are not permitted to open at this time. The city of Hamilton did make the decision back before Christmas through the EOC as we were looking to staff up our vaccination clinics. We did make the decision prior to those regulations coming into effect to close some of our recreation centers, not all, but some of the recreation centers, as well as some of our museums. And that was done in order to free up some staff that we could redeploy to support the vaccination effort. Those staff continue to be redeployed to support the vaccine clinics as those facilities are closed. We have not made a decision yet in terms of as those provincial regulations lift, if some of the rec facilities would remain closed or not. We assess pretty much on a daily basis the need for staffing redeployment to support those vaccine clinics. That has been our priority. And that's something that we have to assess on a daily basis. So at least until those provincial regulations are in place for another week or so, up until January the 26th, ours as well as every other city's rec centers would remain closed. We'll have to assess closer to that date whether or not we'll have the staff available to return to those centers to reopen them, or whether some will be needed to maintain staffing levels at the vaccine clinics. With that, I'll see if Director Herstick wants to add anything further.
Director Herstick, are you there?
Through you, Mr. Deputy Mayor, just to answer the councillor's first question, the majority of the rec centers and arenas were open prior to the closure, councillor. The complaints were coming from residents. We couldn't offer all of the programs, and it really was a staffing challenge for us. We have lost a lot of part-time staff, and with the provincial regulation to have screeners checking vaccinations at the door at each of our facilities, we weren't able to offer the full scope of our programming, and that mainly affected the arenas until we got into December.
Okay.
Thank you. Councillor Jackson.
Deputy Mayor Clark, I know the 16 of us know this, but I think it's incredibly important from time to time with these public agendas and these public discussions that our taxpayers and constituents hear the answers from the bureaucrats overseeing these facilities of the city. General Manager Thorne, thank you for the 3-part chronological answer. That all makes sense. And Director Herstick, I appreciate the fact you reaffirmed some centers were open, but maybe it came down to more of the specific programs some of the constituents were looking to access and just weren't available because redeployment. And I guess my last closing comment, General Manager Thorne, if you don't need to reply, but I guess a closing comment, Deputy Mayor Clark, again, going back to prior to step 2, using the Burlington Brantford examples, I suppose then those municipalities maybe didn't have the redeployment issues and hence we're maybe allowed to keep more programming facilities open. I guess that's something I'll have to just myself check into, but and maybe because they're part of 2-tier municipalities with Burlington and Halton that they maybe had greater availability of resources. But anyways, when these questions are asked, it's just nice to be able to have a sound answer for those that allow us to do what we do at the City of Hamilton. Thanks, Deputy Mayor Clark.
Thank you, Councillor. Any further questions or comments? Mayor Eisenberger, please.
Yeah, just on that last point, it was pretty clear to me as we talk with the Ontario big city mayors, there's a significant difference between single-tier municipality like Hamilton and the two-tier regional governments, where the regional government side is the healthcare, public health responsibility. That certainly is the case in Halton and Peel and other areas where the local municipality is not responsible for manning and making sure that vaccinations get into arms. And that's certainly the challenge that we've faced here in Hamilton. That has not been a challenge in Burlington. And so it certainly has allowed them in Burlington itself, as part of their own resources, to not have to make the same kinds of decisions that we've had to make. Notwithstanding the fact that they're all closed now and we're all on equal footing, the reality is that there is a difference between single-tier response and two-tier response. And I think the city of Hamilton has done what it's needed to do to ramp up the vaccination process as quickly as possible, given the kind of the quick speed of the variant. And I just want to once again compliment Dr. Richardson and the entire public health team and everyone that's come over from the rec centers and the libraries and other areas, museums, that have stepped up and been part of the accelerated vaccination process. Good for them. It's not work they're normally used to, although, in the last year or so, we've had this happen a couple of times, and certainly they're becoming a little bit more experienced, but it doesn't mean that we haven't had to bring in additional people as well to be able to manage that process. And maybe Dr. Elizabeth could talk a little bit about how we've had to augment, rehiring some of the people that we had previously um, let go as a result of the relaxation that we saw for, over the summertime and early fall. And how that has now required us to rehire some of those folks to be able to provide the kind of vaccination level that we're able to do today, which is running at about, Doctor, you'll confirm this for me, 10,000 per day. So hopefully at that rate, by the end of January, we'll have had all the boosters done and certainly a large majority of some of the fourth doses that are being demanded as well. So it's been a monumental effort, and I think that is really the fundamental difference. Just to answer Councillor Jackson's question, that there is a difference between single tier and two tier, and I think I've explained it hopefully accurately. Dr. Elizabeth.
Thank you. Dr. Richardson, please.
Through you, Mr. Chair. Yes, indeed. When it comes to the support that we've had from across the city, it's been actually absolutely critical in terms of getting those vaccine clinics up and running as quickly as we possibly could, and relying on support, of course, from all across the healthcare partners, but particularly for the sorts of things that Chris actually talked about, the screening, the supports that are needed in those clinics. These folks have been absolutely critical, and we're very glad to have them. Indeed, we've tried to be prudent as we've gone through the course and keep as many people on as we needed, and of course downsize the temporary staff when we weren't needing them. And indeed, these were fantastic people who worked for us, and they've gone off. Most of them, when we tried to rehire them, we found they've gone off and found other jobs. And so that was part of our challenge as well when we were restarting the clinics, was that there weren't as many people available to us from outside the organization as we had before. And having people who were trained and understood the process was very critical. And so having our colleagues from across the city come in and help with those vaccine clinics was a very important part of the process as we go forward. We're currently sitting over 8,000 doses per day, Mr. Mayor. We've had a few peak days up at the 10,000 mark. Across all of the different partners combined. And as we've talked about at the Board of Health, as we move into those fourth doses, and we know we want to continue to look at how we can support everybody across the community in accessing vaccine, we'll be shifting our tactics a little bit and going back into those long-term care homes and moving into further clinics to support our community as we go forward as quickly as we can.
Thank you, Doctor. Supplementary, Mr. Mayor?
Sorry.
Nope,
No,
can't hear you.
that's great. Again, I think at some point there's going to be a book written about the monumental effort to get these vaccines into arms, through the past year and a bit. It has been a huge unseen effort that keeps cycling up and down now as we kind of experience different waves. And I can only imagine the challenges that all of the healthcare systems facing right now, and certainly have great empathy and great appreciation for how well they continue to step up each and every day to confront the challenges that we're all daunted by. So I just want to express my thanks.
Thank you, Mr. Mayor, and you have done so. Councillor Wilson, please, you're the next speaker.
Thank you, Chair. Thank you, Dr. Richardson. I just wanted to know if you talked about maybe changing some tactics. I'm not interested in weighing in on the debate on whether the schools are ready for being open or not, and whether they're a safe place for children or not. I am interested in hearing your comments about what I thought I read to be sort of we've hit a ceiling on the vaccination rates for young children from the ages of 5 to 11, which is very concerning for obviously a number of reasons, including reasons of transmission. But I know there's a discussion coming on that. Could you speak to what possibly could be done, or what strategy we need to pursue in order to try and bump those Hamilton numbers up, please, for our young people?
Thank you, Councillor. Dr. Richardson, please.
Through you, Mr. Chair. So when we it come to that group, we did see the greatest uptake in those first couple of weeks at the beginning of December, in terms of the rapidity of uptake as we've gone forward. And then it has slowed over the last several weeks. And we do, work with these groups in many different ways in order to get vaccines into arms. So one is making sure we provide a kid-friendly atmosphere in our vaccination clinics. That's why we've had the booked clinics, to make sure there's time and space for kids as they go through, and their parents that come, the number of people that you need to have in those spaces as we go. And we work with the child life specialists from Hamilton Health Sciences and other practitioners from the McMaster Children's Hospital to promote the vaccines, as well as all of primary care, of course, in doing that work. And so we work through at the clinic setting to make it as comfortable and as accessible as possible, with evening appointments, daytime appointments, different sorts of appointments both in our larger clinics, as well as having community clinics, which we know have been critical as we go forward. Our vaccine confidence team is also working across the community, making sure that people have the information they need in the languages that they need, and they continue to work to improve that, extend it as additional groups come forward or ask for that information, and do that work. The other thing that we'll do over the coming weeks is we will extend more community-based clinics, perhaps in schools, as we go forward. Our priority in the next couple of weeks, as you would have seen at the Board of Health presentation, is to get those fourth doses into the long-term care homes, retirement homes, senior settings, because that's the group that are at greatest risk of hospitalization, of severe illness, and of course death related to COVID-19. So we'll move to help the long-term care home, retirement home, and seniors congregate settings to get those vaccines into arms as quickly as possible, and then be moving into pediatric clinics as well. But you saw us as well open up this week to walk-ins now for pediatric doses, because the pressure isn't there on those clinics as it had been initially. And so there is more time and space for people, even if they come as walk-ins. So very much encouraging people to come out for those vaccines. I think parents are quite thoughtful as we go through this. We've seen that children don't suffer as severely as older adults do in terms of the consequences of COVID-19. And so I have no doubt they feel they have the time to look and see how things are going, how the vaccine rolls out, what we're learning about it. So far, of course, all that information has been positive, with no concerns about the rollout in this age group. So encouraging people, to keep watching, discussing the information with people, either through our hotlines or the Sick Kids hotline, or with their family doctor, to make sure they have the information they need and can make an informed choice.
Thank you, Doctor. Councillor?
Thank you. If I could just probe specifically, I thought, Dr. Richardson, you said in your remarks to me, thank you, that there could be an opportunity for vaccination availability at schools. When I was a kid, our little school had a nurse. I think every school had a nurse back then. And I thought I recall within the last 2 years, the provincial government making provision for a nurse, but for a number of schools. Could you just be more specific on that possibility of actually going to where the kids are, particularly in maybe our postal codes, which where parents work shifts and have some maybe different language um, uh, challenges, if you will. Could you probe that for me? Could you unpack that, please? Thank you.
Thank you. Doctor?
Through you, Mr. Chair, absolutely. You know, those days of the school nurses coming in and giving us our vaccines, I remember those too very well. And of course, for many years, those have actually been public health nurses who have been doing that work in the schools, along with our school partners. We've had over 100-year history of working together on these issues. So as we go forward with these vaccines and looking at this age group, we need to remember that when we're vaccinating children of this age group, unlike the sort of grade 7 and up where we vaccinate them independently, where information may go home to the parent and then the child can be vaccinated on their own, or the teenager can come down and be vaccinated on their own, give their own consent. This is a group where you need to have both the parent there in order to get consent, but also for comfort reasons and all of those sorts of reasons. So it can be quite challenging for a child if they're to be immunized without those supports there for them. And so going into a school environment during the school day is challenging because you would need to have parents there and have all of that sort of support in the school environment while they're also trying to go forward with, of course, teaching and all the restrictions we have in place right now around COVID as well. So difficult to do it during the school day. We have over time done these clinics in the schools outside of the school day. We've used the feeder school approach. That's worked well for us. And so that's the piece that we're discussing actively with the school boards about how might we roll that out after we've done this 4th dose piece in schools. We do have community clinics as well that are out and vaccinating in the community already. We know that strategy and staying in those community clinics has been absolutely key in what we had called our last mile strategy in terms of increasing vaccination rates in those postal code areas, as you say, Councillor, that have had lower vaccine uptake. So we've kept those fixed site clinics as much as possible on the same days. We'll return back to schools to look at appropriate hours when that works for both getting the vaccinations in, getting the parents and the kids looked after well, and the schools to continue on in their mission. And so you'll see that from us come the end of the month and into February.
Thank you. Councillor?
Thanks, Dr. Richardson. Appreciate that. I don't think there maybe was as much empathy for my, which is not a good thing, when I was a kid with respect to needles. I guess there's another, in my closing comment on this, there is another broader societal, I think, good that comes, frankly, from getting those numbers up for young people, although their health impacts may not be as grave with respect to catching the virus. I think it's and we're seeing some disturbing signs. It's in our best interest to have a generation who has trust in science and medicine and understands that we have a collective responsibility to each other. And part of that is taking and getting the vaccine. And I hasten to add that because we're not maybe seeing the uptake, we're putting particularly more of our vulnerable people at risk. So I think it is in our interest to normalize and express confidence in science and medicine, and by getting young people to feel that by getting their vaccines. So that's my comment. Thank you.
Thank you, Councillor. Our next speaker is Councillor Powers, please.
Thank you, Mr. Chair. Just my question to Dr. Richardson is very recently the province announced the ability to activate internationally trained health professionals to assist with the challenges that we're experiencing. Is there any steps that we're taking here in Hamilton to take advantage of those skill sets in needed tasks?
Through you, Mr. Chair. Yes, indeed. Not so much here within Public Health Services. We'll look at that as well and see if there's any application here, but we do know already our hospital partners are on the list to look at how those professionals could assist them. And so that work is very much actively underway to look at how those could be utilized here in Hamilton.
Councillor? That's good. Super. Any further comments or questions from anyone? I'm not seeing any. So I now need a motion to receive the presentation, and that would be moved by Councillor Vanderbeek and Councillor Pearson. And the vote will be up shortly. Thank you.
Thank you, Councillor Partridge. Councillor Nan, I'm sorry I didn't get your vote yet. Thank you.
Thumbs up. And that carried 13-0, unanimous once again. Councillors, we're now moving on to item 10 in the agenda, which is our discussion items. Items 10.1 to 10.5 are the BIA proposed budget schedule of payments for 2022. We can take one vote to approve all of these reports at once if the committee wishes. What is your desire? I see everyone saying yes to that idea. So let's get a mover and seconder to get them on the floor. Moved by Councillor Powers and seconded by Councillor Pauls. And the item is now on the floor. Any comments or questions about it? Seeing none, we'll go straight to the vote, please, Madam Clerk. And the vote's up.
Councillor Partridge, I'm sorry, was that a thumbs up? Thank you.
Boy, that thumb can't get any closer to the camera, I tell you. And that carried 13-0 also. Moving on to item 10.6, which is the Shadok Creek Order Update, PW 19008 citywide. May I have a mover and a seconder to put item 10.6 on the floor for discussion? Moved by Councillor Wilson, seconded by Councillor Nan. Thank you. Staff, is there a staff person that wishes to provide us with some comments? Mr. Winters, you're there.
Good morning, Mr. Deputy Mayor and members of committee. Nick Winters, Acting Director of Hamilton Water. So the report that is in front of you today provides you with a update of where we are with the Shadok Creek dredge plan, as well as the Shadok water quality framework. It also gives an update on a number of items from a motion from early 2020 that we've been tracking and following up on as we have progressed through the planning phases for our work with Shadok and Coots Paradise. We do have Director Carrie Vanderperk here from Hamilton Water today, and it's Carrie and her team who have been stewarding this program. And she is very well prepared to answer any questions from committee with regards to the report this morning or anything else related to the work with Shadok or Coots from a city perspective. We also have Ron Scheckenberger here. He is from Wood. He's our lead consultant who's been helping us in a number of phases, but particularly with the design and permitting process, getting us into the tendering phase for the Shadok Creek dredging. So if there's any technical questions, we can kick those over to Mr. Scheckenberger.
Thank you. Councillor Wilson, please. You have questions of staff?
I do. Thank
Please
you.
proceed.
Before I begin my questions, just some opening comments of appreciation to staff who spent a considerable amount of time with me last week, focusing primarily on project management minutia and some community interests. I'm not going to consume the time of committee with those. I just wanted to express my appreciation. I thought it was a mutually beneficial meeting. And to folks who are listening, there will be a Ward 1 public meeting coming forward, probably May or early June, to detail, because this dredging work, Chair Clark, will have an impact on the residents of Westdale and the residents of Strathcona. So I think it's in our interest to be as forthcoming as possible. And I know you share that interest. So my questions will not bore into those details. I will have some questions that I will repeat here this morning that I did ask of staff, just because I think it's in the public interest to discuss them. My first question with respect to the page 4 of the report, which talks about the deficit between the nutrient loadings from the discharge event and what the targeted dredge is estimated to recover. The table shows a residual deficit of 266 tons of TKN, which I think is nitrogen, ammonia, and ammonium. And I'm wondering through you to staff. My first question is, could someone please unpack what TKN is? And secondly, could someone please detail why, could someone explain that deficit number, which is significant? Thank you.
So Mr. Winters, if you'd like to either refer it to one of your staff or take a crack at the question.
Absolutely. I'll refer questions to Director Carrie Vanderperk, and I'll only step in if it will be helpful for her.
Thank you. Carrie?
Good morning, and through you, Mr. Deputy Mayor, thank you for the question, Councillor Wilson. So I will attempt to answer part of that question, and then I'll likely pass the sort of deeply technical questions or pieces of those questions over to Ron, who is also on the call, as Nick mentioned. So it is well known that much of the nutrients that were deposited during the spill have moved on to Cootes Paradise and beyond. And not all of the nutrient loading will be able to be recaptured during the targeted dredging process. So we are not, and the MECP agrees with the approach. We are not going to dredge for the sake of dredging to remove the equivalent loading. There's just no value there. So we are targeting those areas where we've found value to remove. The purpose of the Cootes Paradise work plan is to study, design, and implement those offsetting solutions that will make up that deficit. So I'm going to pass it over to Ron to explain in further detail your question regarding TKN and sort of the calculations that were conducted to identify the deficit that was involved.
Thank you. Ron, are you there? I'm not sure if he's online still. I think it vanished.
No, he is online through Mr. Deputy Mayor on both his phone. Ron, it appears that your phone is muted now. Ron, I would recommend that you maybe hang up and call right back in, unless you're unable to mute it from your end.
Can you hear me now?
There we go.
Apologies. My phone just started to mute and I couldn't seem to unmute. So through you, Mr. Chair, basically the total Caldol nitrogen, that's the reference to TKN, and that is various different byproducts and chemical compositions of ammonia. And that's one of the targeted contaminants that the province has indicated that needs to be removed and quantified through this project. That along with total phosphorus. And those are the two key contaminants that were associated with the extended period of discharge from the combined sewer overflow. And the matter of deficit is a important one. And Carrie has characterized it well, that we're not dredging just for dredging's sake. We're looking for environmental benefit.
and what is resident within the practical limits of the Shadow Creek is being proposed for removal, but that does result in a deficit, and that is the exact rationale and reason for the supplemental Coots Paradise work plan to look for other projects that are also of environmental benefit and can deal with that deficit in terms of the offset. So there are a series of different projects associated with that I believe council has been previously informed about. And should you have any questions about those, we can discuss them.
Thank you. Councillor Wilson.
Thank you very much, Ron, and also to Carrie. Just for members of the public who are following along, that impact was 47 tons of total phosphorus and 312 tons of total nitrogen that went into Shadow Creek. I'm not trying to score some points. I just think we need to be held accountable for that. And even though some of it has moved on, it's still in our ecosystem. And so I think what the report is talking about is that there are in situ works that we have to do, but there are continuous abatement works that we must commit to that are continuously compromising the well-being of that creek and of Shadow Creek itself. My second question pertains to the work, Chair, that is involved in separating the water in the creek from the solids when they're dredging. And I believe it states that the separated water will be, quote, then either pumped into a nearby sanitary sewer main on dry days or returned to the creek depending on the achievable water quality consistency. So for public confidence, I was wondering if staff or Ron could speak to who will be doing the testing of that um, and how frequently will it be done through this process, so we have confidence that if water is going to be returned into the creek, it at least does achieve those provincial levels. Thank you.
And who wants to tackle that one?
I can start through you, Mr. Deputy Mayor, and I apologize I didn't introduce myself at the last question, and I'm Carrie Vanderperk, the Director of Watershed Management. So to answer your question regarding the testing of the dredgeate material, the water will be tested to ensure that it meets the provincial levels that are required to return it back to the creek. And that testing would likely be conducted by the contractor. And if we find that the testing levels do not meet the satisfaction of the provincial guidelines, then it would likely be, as it mentions in the report, discharged back into the sanitary sewer system. So we'll be looking at a variety of regulatory parameters to ensure not only that it, if it doesn't meet the provincial requirements to go into the creek, that it would meet the City of Hamilton sewer use bylaw requirements to go into the sanitary sewer. And of course, that would only happen during dry weather events. So the contractor would do the sampling. We also have our team in environmental monitoring and enforcement, should it be going back to the sanitary sewer, who would likely be doing conducting auditing sampling during those events as well.
Thanks so much.
Thank you. Councillor, you have 45 seconds left in your time to ask questions.
I do have two other questions. If you could put me back on for one of them, I would like to get one in now. It has to do with how we're defining consultation with Indigenous nations and peoples. Consultation can sometimes mean we just apprise parties or individuals of what we're doing, or sometimes consultation means that we involve them in trying to find solutions, or there is an opportunity to suggest changes. And I would like to give this opportunity to staff to talk about their consultation with Indigenous peoples and what we're defining consultation to be. And then if you could put me back on, Chair, for a second time so I can get to my fourth question. Thank you.
Thank you. Who wants to answer that question? Carrie?
I can answer that question. Thank you for the
Please.
question, Councillor. And through you, Mr. Deputy Mayor, we have had discussions with each of the First Nations listed in the report. We've had some great conversations. Each nation has its own way of wanting to be informed and included in this process. So we are being respectful of that. We have been working very closely with Shelley Hill and her Urban Indigenous Strategy team to ensure that they're in the loop and providing their expertise and knowledge. Hamilton Water staff, so Nick and myself, have been invited to attend the Aboriginal Advisory Committee meeting in March to provide an update on the Chinook file there. And regarding the question that you had about engagement and sort of, identifying what that means, I'm gonna pass that over to Ron, because Wood has been working and taking the lead on this process, and I think he may have some more insight there as to the differences between engagement and consultation.
Thank you, Mr. Scheckenberger.
Mr. Chair. Yes, thank you. Through you, Mr. Chair. There are actually formal requirements for engagement for two of the permits that we're seeking. One relates to the species at risk work, because there's some species at risk within the environment that's going to be dredged, and the other relates to the Department of Fisheries and Oceans permit, and those are formal processes, and they require a pre-consultation with the province to determine which parties need to be contacted, and then there is a means of documentation, and there's multiple points of contact whereby, as Carrie has pointed out, they're initially the different Indigenous peoples and groups are identified, and then they're contacted, and then they're requested how they would actually like to have this communicated to. And over the course of the process, there's different points of contact that are then met in terms of meetings and follow-up documentation of those meetings to support the permitting process. So there are key interests that are relatively typical. They relate to archaeological interests as well as natural heritage and environmental considerations, and those are more or less the typical types of concerns and discussions that are held. Thank you.
Just give me a minute, Councillor. Sorry. Is he speaking on this item? Yes, it's on this item. So then we should finish this question and go to him, have him. It's fine. I can handle that. No problem. Okay, my apologies for that. So we're going to, Carrie, did you have anything to add to Ron's question or answer?
Through the chair, no, I'm good.
Excellent, thank you. Okay, so I have a speakers list of Councillor Nan, Mayor Eisenberger, and Councillor Wilson for a second time. But we did miss a delegate who wished to speak to the Chinook Creek order. So if I can have the indulgence of the committee, we'll have that delegate speak now, and then we'll go back to the questions and answers of staff. Does that make sense to everyone? Someone nod their head. Councillor Wilson?
Yep, I really anxious to hear from Tice. Just in terms of, I have some questions of him. So in terms of you channeling the questions,
Yep.
I just
We'll hear from the delegate. We'll then have questions for clarification from the committee to the delegate, and then we'll receive the delegate, and then we'll go back to questions and answers.
Thank you so
Councillor
much.
Powers? Thank you, Councillor. Councillor Powers? We're good? Okay, so we're all good. My apologies for this. Is the delegate on the line? I don't know. I don't see him.
I'm here. Yes.
Oh, there you are. You're hiding on me. Sorry. You're
No problem.
My apologies for the confusion. Your 5 minutes will start now, sir.
Good morning. I will undertake the share screen. Hopefully we will be successful. My name is Tice Ticemeyer. I'm the head of natural areas here at the Royal Botanical Gardens. I've been involved in the recovery of the bay and all of the related items since 1994, so I carry a lot of history. Overall, we from the Royal Botanical Gardens just wanted to insert ourselves into the process here at council to give you some support for your city staff and all the great work they've done, and to emphasize some points. And basically, in addition, we've reached the end of all of the assessments, and we're now sort of moving into the next step, which is forward and beyond. So I have a few points just to emphasize as with this presentation. So overall, yep, it starts with a lot of great work has happened in the last year and a half. We've been fully involved and quite happy with the process. We've derived several important documents to provide not just the spill remediation context, but a much broader context to help everybody put this set of projects in the end into a needed motion, I guess you would say. Also, this background information is definitely going to feed into many other master plans in the city and growth plans, and ultimately it's a critical element of getting the bay off the areas of concern. It's kind of the next real big project. Beyond that, just to get back to the original, which predates all of the issues of the protection of Coots Paradise maybe a century ago, basically, setting aside as the green space for this end of the lake. That's rather integral to the whole thing, and we'll just highlight a few of the projects that we really pick up just to add our emphasis to what is otherwise a long list and shorten that list. So I see we've really got at the technical element of it, which is the spill boils down to nutrients that really drive environmental structure and public access conditions and aesthetics. We'll carry on with that. I know you've talked about it, so no more to be said other than emphasize it's a bunch. It's a lot that needs remediating. A lot of it is passed through the system. There's still just some sludge left locally. Because a lot is passed through the system, it triggers a set of offsetting projects, which you're talking about. The vegetated mats out there, which are basically bioremediation, draw nutrients out of the system and move them. Short-term aeration, as we have too many nutrients, which are drawing out the oxygen from the water, which quite transforms for the negative what you actually have alive out there. Then putting back together some shorelines and how we might mitigate accumulated sediment out in the deeper waters that are at issue. But jumping over to the Royal Botanical Gardens as a background element, sort of a two-pronged thing that Royal Botanical Gardens is, and we've been around as an organization for so long that two-pronged thing often gets lost. One, it's public access education gateway kind of operation along what was originally the original highway into the city of Hamilton and Ancaster, Dundas, all that, which is York Boulevard. So Rock Gardens on one end and the city's on the other, and it's a greenway into the city. That feel of the gateway entrance obviously was a bit changed when 403 was put in, and the passage into Westdale via Longwood was kind of severed, but it's still there. The other element, of course, is Coots Paradise being the tip of Lake Ontario serves some rather broad functions, hence my big map there on the right, where you would see Royal Botanical Gardens, you might as well say Coots Paradise, the tip of Lake Ontario. What you have going on there, which triggered first a commercial fish sanctuary for the bays and the lake's fisheries back in the 1800s, and then a game preserve officially in 1927. But you're looking at really supporting the commercial or recreational fishery of Lake Ontario as the marsh, the rivermouth marsh that is Coots Paradise, is where fish of the lake come to spawn, pretty much all of them. There are other marshes like Coots Paradise, but for If you were to chop Lake Ontario right in half and take an east and a west, Coutts Paradise Marsh, hands down the biggest of the river mouth marshes, and thus the most relevant of them for fisheries production. Beyond that, you have large-scale bird migration routes that travel across the continent. They travel the Great Lakes. Birds, for all that they can do, they like to fly around water, not over water. And so having rest stops in their grand migrations is really what drove the 1927 Crown Game Preserve, create some space for these birds that might end up in Alaska, for example, and southern Chile in the wintertime kind of thing. This all hinges off the quality of the water. And that's sort of the essence of the Royal Botanical Gardens. What really came to be where part two, right? So part one, environmental education gateway, quite straightforward. Part two came because the Crown Game Preserve was really not working. And so it became part of a separate set of properties that then is now the Royal Botanical Gardens' largest piece, Coutts Paradise. There's various versions of the RBG Act over the years. But just for a little inspiration of why we all worry about this, the commercial fishery, the fishery side, spawning grounds. Currently at the outlet of Coutts Paradise, there's a carp barrier. The carp are an introduced fish that can survive under low oxygen and terrible water clarity, and they live off pulling things out of the bottom. All the rest of the fish that normally you would look for support a commercial fishery, they like clear water and oxygen. So here's an example of one. I picked this fish, which is the yellow perch, because it's one that we can a little more easily connect to. The reason we have a hard time connecting to commercial fisheries on the Great Lakes is Lake Ontario's commercial fishery more or less disappeared in the early 70s, and so we've lost that element. It's kind of one of the only Great Lakes on the planet that really doesn't have a substantial fishery, and it's certainly a water pollution infilled habitat thing. The perch. We all know perch just because of Lake Erie perch, yellow perch. That's what it is. It's that very fish in the hands. This is one from the fishway. This happens to be a supersized one. It's a female. She comes in, she spawns, she goes back out to the lake. How many little yellow perch we get feeding into the lake is a function of how good the water is. The original fishery of this region was, of course, the poster species was lake whitefish, but yellow perch was right there in the list as an example. And there is a long list. But that's the reason. It's all about food, Lake Ontario fisheries. In the background, there's a lot now developed in the background documents to help guide how things go forward. Probably the most exciting one is the water quality framework, which is essentially a watershed plan for Shidok watershed. It is completely an urbanized watershed. It's been in urban area for, you might go as far as a century. And so its challenges are all urban land use related. Beyond that, of course, we have remediation plans just for the spill, and then we have a Royal Botanical Gardens current master plan that puts context to that particular area where Shidok Creek enters, which is basically the waterfront, and also puts context into the nature reserve side of it. The water quality framework, so that watershed plan, really tries to put context on the relevance of sewer overflows, where the 403 runoff might fit in, the landfills, the railways, and certainly urban. It then also creates a little pie graph to go of all the creeks that flow to Coutts Paradise, of which there are many. You just take the bigger ones. Where does the sources of phosphorus, and we like to pick on phosphorus because it's the magical limiting ingredient to growing things, be agriculture growing or water growing. It's phosphorus is your magic. Phosphorus is a natural element in the water, and so too much phosphorus is where the problems start.
And Tice, do you have much more? Because that's the end of your 5 minutes.
Just a couple.
Much more?
Just a couple.
Okay, so let's move through those and
thank you.
Thank you.
My apologies for the complexity. I tried to make it short here.
We understand.
So you would find this graph, which gives you context. You can see Shidok. If you just pull it all together in the pie graph, it's a big one. But if you skip it, I'll go a little further to, let's see. That's the master plan, just letting you know it exists. Overall, you have Shidok in the lower corner. On the waterfront, sort of the public route is through here. The nature reserve is out here. That's the gist of it. Here we go. The nutrient problem of phosphorus. If you take the totals, Shidok's a pretty good slice. If you take the amount that's beyond what naturally would occur, Shed Oaks is supersized slice. That's what it amounts to. You have the wastewater plant after that. And then you have Boers Creek from Waterdown, Ancaster Creek from Ancaster Dundas, and Spencer Creek. The giant river of the whole end of the lake is actually quite good, but it still gets over the line sometimes. This is the consequence of it. These are actual pictures just from last year out there. This is algae of different forms and types. It comes and goes based on temperatures and combinations of nitrogen and phosphorus, but it is quite impressive at times. That's just a reiteration of that. It's about tons and offsetting. CSOs, I did want to hit you with this one. There are a number of sewer overflows to Coots Paradise. This is really, in essence, the sources that have to be gotten at for water quality. There is a policy objective of let's have those sewer overflows only spill once for a 5-year rain event. That's the current approach, which is a fair haul of rain, let's say 1.5 inches. Out of the list, if you count down the list, there's 9 over there. That list grows as more and more investigations occurs. Out of the list of 9, 3 of them actually have mitigation measures. In the year 2020, that pool spilled about 39 times because there isn't in 2020 monitoring of them all. There's just modeling. You're roughing it in at 39. The useful thing to know is of all of the tanks, the oldest one is the first one in the list, Main King, which is our source issue. The last 2 are the newest. The last 2 met exactly the policy objective with 1 spill because there was a giant rain. But that's where the work is. Overall, I did want to highlight just the watershed of Shed Oak to give you some insight into something that's quite significant that came out in the process. Shed Oak, which discharges to the waterfront down here over on the right on my map, has 2 components of its creeks. So there's the link up there, that's the escarpment, and the waterfront. 2 components in my circles that actually get subsumed by the sewer system, go into the sewer overflow tanks, go to the wastewater treatment plant, never reaching Coots Paradise. So there's a lot of water which is contributing to the overflows that are just simply the surface water of the creeks being piped out of the natural environment and into the wastewater system. And so working on those 2 really can transform how often sewer overflow tanks get overwhelmed. Beyond that, because there is such a list of issues, there is some short-term mitigation measures that would be needed if you want the waterfront to be trustworthy to visit every day. Beyond that, that's where I would wrap it up, but it's I'm trying to highlight it's a complex world out there and a long history of changes that need to be made. It is kind of the #1 outstanding item, this watershed for recovery of the bay. It's not the only one, but it's the biggest one. And on this end, we're ready to help out as much as we can with supporting communications and providing information into the process. Thank you.
Thank you for a very complex presentation. Would you mind please unsharing your screen so I can see the potential speakers that may wish to ask you questions?
There we are.
Perfect. Thank you. Councillor Wilson, I have you up first to ask questions of clarification to our delegate.
Thank you. Thank you, Mr. Teismeyer. For folks who may not be familiar with you and your work, I think it is important as head of natural lands, what is exactly your responsibility through the chair?
Thank you. Nice.
Certainly, thank you for the question. Overall, I am responsible for basically monitoring the condition of the property from an environmental perspective, as well as managing and creating the opportunities for visitation and education to the areas that aren't the formal gardens.
Thank you. And through the chair, Tice, you referenced the RBG Act, but in summary, I'm trying to understand both the responsibilities and the tools. So is the RBG responsible for overseeing the quality of coots or just alerting us to it, and or what tools do you have at your disposal to reach the objectives of your mandate with respect to Coots, through the chair?
Certainly. An excellent question that's become more complicated with evolving legislation with other parties. Ultimately, we have the ability to regulate use of the water. This was formerly part of the Harbor Commission's territory, being a port, and so that ability was transferred to the RBG in the 70s. Beyond that, we have the ability to regulate to a certain degree the comings and goings of people, impact local species as they are on the property, and in the case of water, provide status information on what's coming and going and what it's like, which through other processes and tools then is intended to feed back into, well, if downstream this is the condition of the water, which we collaborate with the Ministry of the Environment to even accomplish that, because that's not originally part of our mandate. Then what are the actions that would then feed back? And so that was basically how the remedial action plan itself was set up. We have the ability to access and get information about the water locally much easier than any other partner, and so we provide that into the pool of remedial action partners, and that is then intended to inform priority projects for moving things along. But otherwise, we're status reporting on condition downstream. That's
Sorry, Tice.
That's how I sum it up.
Thank you. So I'm going to summarize it in the following way, and you can, in your opinion, say if it's appropriate or accurate. I think you said how many urban creeks flow into Coots? 5?
Right, you're asking, yes, the real number is 17, but several are quite small and local. So the ones that extend well up into the communities are 5.
Yeah. So you're in receipt of everything, but you have very little ammunition to do anything about it.
That is essentially the system. The system was heavily provincial run for that element of it. So that's formally and still a significant role of the Ministry of the Environment. It would have had the Ministry of Natural Resources, now Ministry of Natural Resources and Forestry, etc. And then more recently, you would have had the Conservation Authority, who was receiving responsibilities from the province, and at one point even from Fisheries and Oceans, who was really your water lead on the Great Lakes. And that's sort of moved back and forth, and it's currently back with Fisheries and Oceans. But yes, we have little control. The system was set up for those other organizations for water.
That's got to be frustrating. Thanks. I'm not sure I understood. You had a chart up, which was referencing the significance of Shadok Creek, but you're talking in that chart, and I beg your pardon because I didn't get the number of the chart. You were talking about the tributaries of Shadok that don't make their way into the creek per se, that actually just go directly to the water treatment plant. It never reaches Coots. So could you just expand on the importance of that for our remediation plans moving forward?
Absolutely. To me, this was the most important detail uncovered during the investigation process of what is the condition of the watershed, because these are things you would not assume. So ultimately, you can think of Shadok Creek as having 3 sub branches that go up onto the escarpment, following 3 lines coming together down basically at the 403 area. The east and the west creeks have been buried for a long time, and I would say accidentally, probably. The creeks themselves then are in the pipe system. Originally, they're in separate pipes from the sewer and wastewater. But because this is the old combined area of the city, so creeks and sewers spill together, ultimately, 2 of the 3 branches just became fully piped into the existing sewer overflow tanks. So if you were then think of surface water, if you go to Iroquois Heights Conservation Authority Authority up on the escarpment, where lovely spring water for Shadok emerges up by the intersection of the Link and the 403. Lovely spring water headwaters, Iroquois Heights Conservation Authority. That water then comes off the escarpment, lovely clean water, goes into the pipes, and never reaches Coots Paradise. So all day, every day, that creek is going into the sewer overflow tank, pumped to Woodward Wastewater Treatment Plant for treatment. When it rains and it becomes a larger creek, that is when the larger creek is now filling the tank quite rapidly, and the tank then can't keep up and it overflows. And so, A, we don't get clean water down to Coots Paradise from that creek or the other creek, and B, we're treating creek water at the wastewater plant.
So thank you. I'm consuming a lot of time, but I think that point is really important, that there is clean water that is at the headwater of Shadok. We're pushing that water into our gray system and adding to the overwhelming, or sometimes overwhelming, adding to the capacity of the water in that system. And we're treating water, frankly, that doesn't need to be treated. It doesn't seem to be efficient and a good investment. So my final question then, Tice, what's the alternative? Is it daylighting up there, the opportunities? Like what could we do possibly? Thank you.
You've hit the nail on the head. The good fortune of certainly one of the two tributaries, it's really just a greenway where it runs. It's just buried at the moment. And so daylighting or just even underground separating creates a green corridor, which serves many future other purposes. The west, more the one that comes from the St. Joe's Hospital direction through Lock Street, is a much tougher challenge to get at. That one will take some real hard thinking because that is an intensively developed part of the city. But the one that comes to the Royal Tank, which comes from Iroquois Heights, is easily daylightable. I mean, nothing's really easy, but if you had one that was a doable one, that's a winner right there.
Cost efficient and easy.
Yeah.
So to my colleagues, if you don't know Tice, and if you have some time on your hands, if you were interested in learning about your creeks, and I know you all are, the best investment of time you could make was ask him for his time, and he would take you out. And every time I'm out with him, I learned something. And nature and investment in green infrastructure is actually a really efficient use of public dollars. So I just wanted to show my appreciation to his patience with me, and his guidance on trying to learn about these things. Thanks, Tice.
You're welcome.
Thank you, Councillor, for your questions and your comment. My apologies, councillors. Earlier on, my WebEx system crashed, so I had to reboot it, so I disappeared for a minute, but I'm back. Councillor Vanderbeek, I'm starting the clock for you now.
Thank you. Thank you, Mr. Chair. Actually, my question was just answered. I was looking for an explanation on slide 11, which is the Shadok watershed opportunities, where the wording talks about the water not reaching Coots Paradise, that it's a source of the CSO tank overflows as it's fully piped into the tank system. And Tice, thank you for the explanation. That helps a lot. And I may reach out to you offline to get a little more understanding of some of what's in this amazing report. Thanks so much.
Thank you. Any further questions or comments from committee? Seeing none. Madam Clerk, I do not recall if I have a mover and seconder to receive the presentation. Thank you. I need a mover, Councillor Vanderbeek and Councillor Nan. Thank you. And the vote will be up momentarily to receive the presentation. Thank you, Tice, for your time today. My apologies for the earlier confusion. Just waiting to close the vote.
Councillor Vanderbeek, are you able to send your vote through? Councillor Farr, are you still with us?
And Matt, I'll need the folks who wish to speak to or question staff on this one. We had moved them all. Yeah, that's the first one. But Mayor Eisenberger was on that list too. Oh, okay. Just losing my mind slowly here. That vote carried 12-0. Thank you. Councillor Nan, you have questions of staff with regards to the Shadow Creek order?
Thank you. And it's only January 12th, Chair. I hope your mind comes back quickly.
It went.
It's back.
Thank you.
Through you. So the question, there was one comment and two questions that I had. The first one was touched on by Councillor Wilson. It's reference to page 2. And so I just wanted to make sure that I understood the response clearly from staff. So when the report indicates that we're going to be either pumping the separated water back into the sanitary sewer main or returning it to the creek, and the language there about depending on the achievable water quality discharge as compared to the provincial objectives, that's hinged on whether the water is going into the sanitary sewer system versus being returned to the creek. So in terms of meeting the provincial objectives and provincial standard of quality being returned into the waterway. Thank you if that's clear.
So through you, Chair, yes, that is the intent, so that the water meets the provincial guidelines. The ministry has talked to us about the potential of returning the water into the creek. That's the preference. However, if it does not meet those provincial objectives, then we do have the option of pumping into the sanitary sewer.
Thank you. And through you, just to follow up then on that. So if we cannot get the water separated and meeting those provincial targets, and then we have to hold it and then put it into our sanitary sewer system during dry days, how does water return to the creek?
Thank you. Carrie?
Through you, Mr. Chair, I'm not clear on the question. Could you repeat the question?
So if we're holding the water because it doesn't meet the provincial objectives or standards through the process, and we're holding it to send it back into our sanitary system, when and how does water get returned to the creek? If it's being bypassed that way, yeah.
Okay, thank you, Councillor. And I am going to refer this question to Ron for his response.
Thank you.
Great, thank you.
There you go.
Through the chair, in fact, the water would not be returned to the creek. The water would go to the Woodward Avenue wastewater treatment plant, and it's a small fraction of the total. But as Carrie has indicated in consultation with the province, their preference is that it does be returned, but that's subject to obviously meeting those water quality treatment parameters. So that water would be lost to the creek over the period of the dredging, but it's a very small fraction.
Small fraction.
Thank you.
Okay.
Councillor Nan?
Thank you. And the second question was around the Indigenous engagement, which I think got answered in your responses. I did want to just reiterate my comment to staff in my appreciation for the report that's before committee today. It was very thorough, but yet concise. It was easy to follow. It was clear what the work plan is entailing to accomplish. I appreciated the timelines that were associated. I also appreciated the appendix that continues to measure the progress that we are making towards our action plan and the previous motion. As it relates to Indigenous engagement, the clarity that was provided in this report, I think it's the first time that I can recall as a council member getting that question answered in writing, and I truly appreciate it. It's a critical piece of accountability for our municipality, and I'm really glad to see this work continuing, and I'm hopeful that it will lead to stronger nation relations as a municipality, not only on the work related to Shadok, but overall in our adherence to the land acknowledgement statement we start each council meeting with. Thank you.
Thank you, Councillor. The next speaker is Councillor Tom Jackson, and then I have a second speaker of Councillor Wilson. Councillor Jackson, please, you have the floor.
Thanks, Deputy Mayor Clark. Thank you, Acting Senior Winters, for introducing this report, and Director Vander Perk for for your authoring of the thoroughness of the report too. Can I just ask, Nick, it's prepared by a Tim Crowley. I've never heard that name before. Can you just maybe explain the title and who Tim is within the department, please? Through you, Deputy Mayor Clark.
Thank you. Nick?
Absolutely. Tim is a project manager who works for Kerry, and he has been really the driving force behind the technical aspects of the project. He's done an excellent job. He did do the lion's share writing the report as well. So, the compliments that have been received both during the review process and from council, or excuse me, from committee today, certainly he deserves a lot of credit for that.
Thank you, Acting Senior Director. It was, at least for my edification, to know Project Manager Crowley and pass along my commendation for all the technical information he's provided in this report. To the consultant, Scheckenberger, Ron, and from a couple of years ago, you were the consult. There was one consultant that basically said do nothing, with Shadow Creek and Coots, and Wood Environmental gave a differing opinion. And I've come to learn and delve more into Wood Environmental Consulting and a greater respect for your opinion moving forward here. My question to you, through you, Deputy Mayor Clark, to Ron, is are you satisfied up to this point in time where the Shadoke and Coots work plans stand? And given your network and Wood Environmental's respected network across the province, working with the MECP, are you satisfied as well that that everyone is on side as we are moving forward at this stage of this report? Through you, Deputy Mayor Clark, please, to the consultant.
Thank you, Councillor. Mr. Scheckenberger, please.
Through the chair, thank you for the question. And yes, in terms of being satisfied, we're quite pleased with the progress thus far on the targeted dredge plan. It's been the primary focus of the first part of satisfying the provincial order. And the second part is obviously, as Tice, I think, indicated in his presentation, it's really the ultimate goal, and there's many different pieces, and there's considerable amount of work that is ongoing on multiple fronts with the city right now in terms of additional studies, data collection, and actual field action, some of which you've heard of before, some of the piloting of the floating mats and some of the aeration devices as well. So there is a lot of work going on, and we're very satisfied in terms of where this has proceeded. And we're also very encouraged by the amount of integrated consultation that we've had with our agency partners. There's a host of them, as I think you're aware from the report, at least half a dozen, and each of these has been consulted before we even develop the work plan, during the execution of the work plan, and now in the final phases of permitting. And thus far, all the feedback from them has been very positive, and it's contributed to the betterment of the project and our understanding.
Thank you very much. Yeah, thanks very much, Consultant Scheckenberger. You've cautiously, hopefully, raised my comfort level to hear your professional opinion as to the state of where we are with the work plans. And I counted between pages 2 and 3, you said a half a dozen. I counted between pages 2 and 3 of this report about a dozen stakeholders, and above all with the MECP. And so I'm comforted to hear where we are at this stage and moving forward to get things right. Thanks, Deputy Mayor Clark.
Thank you, Councillor. Councillor Wilson, for a second time, please.
Thanks very much. The bulk of the remainder of my questions are going to be focused on some language which is set out on page 6 and 7 of the report. If you're following along at home and have the report in hand, it is in specific reference to the 3 master planning EA studies that are identified. It states on page 6 that the studies will be completed in 2022, and the identified preferred projects will advance into design in 2023, with construction expected in 2024-25. It says it is important to note that the order does not specify completion deadlines for the proposed initiatives identified in the Coots Paradise work plan. So my question through the chair to staff, as it states, there's no deadline for its completion. The report goes on to say that we've set aside $20 million for the work that will come out of those EAs. What kind of assurance can you give us to council that despite it not being part of the order in terms of a deadline, that we're going to be able to meet those objectives? And when would we know in this work whether the $20 million will be sufficient or not? Thank you, Chair.
Thank you. Carrie?
Thanks for the question, Councillor, and through you, Mr. Deputy Mayor. Yes, there are a number of studies that need to be conducted. We are kicking off the EA process for 2 of those 3 studies, essentially very shortly. We're going through the procurement process as we speak. So with regards to the assurances about the budget, I think at this point we've set aside some money to touch on some of these projects, but until we get through the process of the EAs, we won't have a definitive idea of the costs. So the money that's set aside now is really a general guesstimate of what some of the works that might be required throughout that process. So as we get through the EAs, then we'll have a better idea, and the budgeting process will ensue.
Thank you. Councillor?
Yep, thank you. Obviously, I think it's in this municipality's self-interest to commit to this work and to do the necessaries, because as Tice noted, the quality of that world recognized area is significant, and its impact on the ecosystem ultimately impacts the health of our residents and beyond. I have one other question and then a comment. The roads retrofit rehabilitation, who is charged with that in the organization? Thank you.
I'm not sure who wants to answer that. Carrie?
I can answer that through you, Mr. Chair. So that is something that we will be establishing an internal committee for. So I've put a call out just before the holidays to our colleagues in engineering services, our colleagues in planning and economic development, as well as within other areas of public works, to have members of staff involved in that committee, so that we're touching all of the various responsible parties to discuss those policies and have those discussions around the table.
Okay, thank you very much.
Thank you.
Just a closing comment, and Councillor Nan, I thank her for her comments. I'm very appreciative of the work of staff to date. I'm very appreciative of their willingness to spend time with me. I'm very appreciative of how this report was written. It's succinct, it's easy to follow, and I think it holds us accountable for works. It holds us accountable because, and we saw this in the language of our budget, we should be, in my opinion, moving to a needs-based budget. We have been underinvesting in too many parts of our infrastructure, and I think it is the responsibility of this council to make those informed and sometimes difficult decisions. 47 tons of total phosphorus, 312 tons of total nitrogen. That's what the impact is, and I think we have to do right by this biosphere. I think we have to do right by our community, and I think we have to do right by our reputation in doing all that we can. When you know better, you should be doing better, and I'd like the staff thank them for the work and the openness in helping us understand this. So my appreciation very much.
Well said, Councillor. Thank you very much. This motion was moved by Councillor Nan, seconded by Councillor Wilson. It's to receive the report. All those in favor? The vote is up now. And it carried unanimously 12-0. Thank you. 10.7, the Advisory Committee for Persons with Disabilities Report 21-023, December 14th, 2021. May I have a mover and seconder to put the item on the floor? Moved by Councillor Jackson and seconded by Councillor Vanderbeek. Any questions or comments about this item? Seeing none, we'll move to the electronic vote, please. The vote. Thank you, Madam Clerk. You're fast today.
Councillor Farr, you should be able to see it now. I've marked you back in. Councillor Farr wants to speak.
Oh, sorry, Councillor Farr, I didn't see that you wished to speak. Sorry. Go ahead, sir.
No problem. I'm just going to signal my vote. I was also present for the last one. I'm just rebooting my e-scribe. It's not working.
Yeah, we've had one of those technological days here, I tell you. Thank you, Councillor. Just waiting to close the vote. Vote's now closed. It carried 13-0. Thank you. We're moving on to item 10. The amendment to the mandatory COVID-19 vaccination verification policy, HUR 21008. May I have a mover and a seconder to put 10.8 on the floor just for the discussion point. Moved by Councillor Pearson, seconded by Councillor Partridge. As there is a private and confidential report respecting this matter, the committee may wish to discuss prior to considering item 10.8. If that is the case, then we'll need a mover and seconder to defer the vote. Does anyone wish to hear from our legal counsel before we make a decision on this today? I see Mayor Eisenberg nodding his head. Mr. Mayor, is that correct?
Yes, indeed. I think that that would be critically important. But I mean, I think the preamble in terms of the public session should be that staff should make their presentation on this, and then we head into legal to get our advice, and then come back to deal with the issue out of camera.
Thank you, Madam Clerk.
Yes, through you, Mr. Deputy Mayor, there is no presentation with this report. It's a discussion item unless the mayor wishes an overview from staff. Is that what you're asking for, Mr. Mayor? Sorry.
I am. I think it's worthy of I think some words from either HR or city manager in terms of some preliminary explanation, and then and certainly legal impacts will certainly have come to bear. But I think it'd be worthy for us to hear from HR and from city manager and others. I know its senior leadership team have all supported this as to what their thoughts and rationale is.
Thank you, Mr. Mayor. I think that's excellent advice. So let's hear from staff, and then we can vote to defer the final decision until after we get the legal advice. Ms. Fontana, please.
Thank you, Mr. Deputy Mayor, and good morning to members of council. Laura Fontana, Executive Director of Human Resources. So council will recall their approval of the COVID-19 mandatory vaccination verification policy back in August of last year that mandated employees to provide proof of full vaccination in the workplace, and that those unvaccinated staff without an approved exemption, or those staff choosing not to disclose their vaccination status, were subject to the rapid antigen testing program. So these unvaccinated employees have been participating in the program since November 4th of last year through weekly testing that's essentially been conducted every Monday and Thursday. To date, the city has secured these rapid tests from the province free of charge, and the employees participating in the programs have not had to pay for any associated costs. But more recently and more importantly, we've been experiencing significant challenges in securing an adequate and stable supply of the rapid tests. And even the limited supply that we've been receiving, we've needed to prioritize them to higher groups and settings. So we continue to be concerned as to the ability to secure an adequate and reliable supply of tests on a sustained basis. And we also feel that we're vulnerable as to guaranteeing these supplies going forward. I should also mention there's an evolving science as to the efficacy of the rapid test, and particularly as it relates to the frequency of their applications. So the city, as mentioned, tests twice a week, and we feel that this may not be enough to ensure a safe work environment, that that might need to be increased. But again, we're very compromised in terms of having that full knowledge as to whether or not twice a week is sufficient. You know, I would say that regardless, the ultimate goal of the city has always been to achieve full vaccination by all of the employees, and that the rapid testing program was never intended to continue in perpetuity. We've been working with the province and private sectors to secure a supply of rapid tests that will help us transition to a situation where all employees are fully vaccinated. But right now, the supply of rapid tests that we have will last until January 17th, but we've also received assurances from a private vendor that will receive additional tests that should get us through at least to the end of February. And beyond that, we're going to continue to work with the province and private vendors to secure a future supply as best as possible. So today's report to council is recommending that we amend the current vaccination verification policy that incorporates a sufficient notice period, in our opinion, that will allow employees to get vaccinated, and that their failure to do so would result in their eventual termination of employment. So save and accept members of council and members of council appointed committees, which we do not have the authority to terminate, where we are proposing that those unvaccinated staff without this approved exemption, or again, those that have not disclosed their vaccination status, will have until May 31st of this year to provide their proof of full vaccination proof, and failure to do so would result in their termination of employment effective June 1st. So these employees would continue to participate in the rapid testing program until May 31st. We also included in the report that in the event the city is not able to secure an adequate supply of tests between now and the May 31st date, that any employee who would otherwise be restricted from attending work due to the lack of available tests would be placed on a paid leave of absence pending the continuation of the program. But having said that, we're very hopeful that we're not going to experience any significant delay in securing these rapid tests. Another note, Labor Relations has met with several union leaders to explain to them the challenges with continuing with the rapid testing program and our planned amendments to the policy. I can also confirm with council that 93% of our employees are fully vaccinated. We have approximately 474 employees that are participating in the rapid testing program, and approximately 68 employees that are currently on an unpaid leave of absence, which essentially includes employees not disclosing their vaccination status or their unwillingness to participate in the testing program. So we're hoping with this change in policy that there'll be more employees getting vaccinated between now and the termination date, and this would appear to be the case, particularly with other municipalities that have incorporated similar provisions into their policies. Again, we've consulted with legal services, and that is the in-camera report referenced earlier, and happy to answer any questions. And there's also staff available to answer any questions from with respect to this report.
Thank you very much for that. We have a long list of speakers, starting with Councillor Wilson, Pearson, Powers, Farr, and Jackson. Councillor Wilson, please.
Thank you, Chair. Forgive me if it stated this in the report. It talks about the work that the city organization is having to do in the oversight of the testing. Do we have an indication of the cost that we've had to bear for overseeing or administrating that? Thank you.
Thank you, Ms. Fontana.
Through you, Mr. Deputy Mayor. At this point, in terms of a staffing, from a staffing perspective, we've absorbed the additional responsibility. So our occupational health nurse and our health and safety team have absorbed the majority of the workload associated with administering the program, recording the program, and then reporting any positive outcomes in terms of the rapid tests. Up until now, we've received the rapid test free from the province. As I mentioned earlier, we don't have assurances that the supply from the province is forthcoming. And in the meantime, we are securing an additional supply from a private vendor. And the cost, as we understand it at this point, to continue with the program until the end of May would be approximately $80,000 if we secured them through the private vendor.
Thank you. Councillor?
Thank you. Through the chair, I'm referencing a sentence that is set out on page 3 of the report, which I'm trying to understand in terms of its implications or what it's trying to tell me. The sentence reads as follows, and what comes before that sentence is a reference to the practices of other municipalities. So specifically, it says that in the case of Durham, Niagara region, Toronto, York region, and others, they did not give their employees the option of rapid testing. It goes on to state then that Hamilton's unvaccinated complement is significantly large compared to other municipalities, and quote, this may be attributed to the fact that our policy does not currently have a termination provision. So my question is, are you able to share with us the successful vaccination rate of the complements in those municipalities that did move to a strict termination policy without the practice of ongoing rapid tests? Thank you.
Thank you. Ms. Fontana?
Thank you, through you, Mr. Deputy Mayor. In conversations with our HR network and in other municipalities, I've been told that since announcing the termination provisions in their policies, they've seen an increase in their vaccination rate of their employees. Their numbers are relatively small compared to us. Again, it's never an apples to apples comparison because we're one of the larger municipalities. But they did indicate to us verbally that their numbers in terms of vaccination status did indeed go up once the termination clause was introduced or incorporated into their policy. But in terms of numbers, I don't have that statistic necessarily, but generally speaking, that is the result as they've indicated through their respective policies.
Thank you. Councillor?
Thank you. My next question takes me back to August of last year, in which the policy and the report came before this committee. And I went back to that report, and under alternatives, there was no alternative offered that would be similar to Toronto and York. And I'm wondering if Ms. Fontana could account for that for us. Thanks.
Thank you. Ms. Fontana?
Thank you. Through you, Mr. Deputy Mayor. Back in August, Council may recall that we were one of the first municipalities to adopt a policy. I think Toronto was just ahead of us, but we were one of the first ones to adopt a mandatory vaccination verification policy. And we took a very thoughtful approach in terms of incorporating an education component to the policy. We wanted to educate our employees, particularly on the benefits of vaccination. We didn't want to go straight to termination because we did want to allow for some period of time that would allow employees to adjust to the policy. We wanted to allow them to attend work and still have the choice of whether or not they wanted to be vaccinated and incorporate the testing provision. So we were one of the few municipalities that did incorporate the testing program. But again, we wanted to have a more methodical process so that the employees could have that choice. But the ultimate intention was always to end the program, that it would not carry on in perpetuity. Currently, we have an issue with the supply in terms of the stability of the rapid tests that will be available to us going forward. We're also concerned with respect to the efficacy of these tests. that whether 2 times a week is still appropriate, and if it will provide us with the information we need to ensure a healthy and safe work environment. So it was a staged approach. We wanted to see what other municipalities did. We wanted to see the response in terms of our vaccination rates, but we've now reached a point where we need to make other decisions and recommend termination in order to preserve the health and safety of our workforce and to help boost the vaccination rates within our workforce.
Thank you, Councillor.
Thank you. I'll save my questions for perhaps after the briefing. Thank you.
Thank you. The next speaker is Councillor Pearson, please.
Mr. Deputy Mayor, and to Ms. Fontana, just a couple questions with regards to the report and the recommendations. I'm a bit confused of the verbiage, and I just want to be sure. So on page 1 of 9, it says recommendations, and it goes down that save and accept members of council and members of council appointed committees. Could you please clarify that?
Through you,
Ms. Fontana?
Yes, through you, Mr. Deputy Mayor. Those are non-city employees. Those are private citizens that participate on our committees that attend committees on behalf of city business. They are non-city employees.
Understood. So it actually is citizen committee members.
Yes.
Wondering
I
if we should put
apologize for the confusion.
Yeah, city. I just wonder if we should put citizen committee members as well in there. That might be something to look at. And thank you for that answer. And Ms. Fontana, I've received some emails. I think we all have, but unless you have a medical exemption, this policy recommendation going forward will be mandatory. I'm hearing that there are many doctors who are not prepared or concerned with providing medical exemptions. Have you heard that through any of our staff who are not vaccinated yet?
Ms. Fontana?
Through you, Mr. Deputy Mayor. No, I haven't heard that, and I can also report that we have a very small handful of employees that have submitted medical exemptions for vaccination. So it is a very small group of people, less than 5 organization-wide, but I've not heard that feedback that physicians are willing to provide these medical notes.
Thank you for that. And my last, just I appreciate the answers you gave to the former speaker with regards to the tests and testing being done twice a week. Because I remember when this first came about a few months back, I asked the question whether this would be through our city insurance provider, and it was confirmed by Mr. Zagirik at the time that we do get funding from the province currently, so it is offsetting the cost of the tests. Is that still the case? And I believe you said there is going to be a cost now because we have to purchase them over and above, correct?
Ms. Fontana?
Deputy Mayor, till this point, we've received our rapid testing kits from the province free of charge, but we've not received assurances that they're going to continue to provide us with a supply of testing kits. They're reprioritizing, and understandably so, to settings that require it more than we do. For example, the hospital setting, the schools, and so forth. So they have not been responsive to our requests for additional supplies. In the meantime, we've been working with a private vendor to secure the supplies, but that's not to say that we aren't going to continue to work with the province in order to secure these tests. At this point, they are still provided to us free of charge, and employees have not been paying for the tests.
Thank you for that. Thank you, Mr. Deputy Mayor.
Thank you very much, Councillor. Well within your time. The next speaker is Councillor Russ Powers, please. Councillor Powers?
Thank you, Mr. Chair. I have 2 questions and maybe a supplemental. My first one is, what is the definition, the city's definition of fully vaccinated?
Ms. Fontana?
Through you, Mr. Deputy Mayor, at this point in time, it's 2 doses of the vaccine until we get other direction from the MOH or public health. The full vaccination definition is 2 doses of the vaccine.
Thank you.
Thank you. Councillor.
My next question is, you were started to tell us about, I believe there's 474 that have indicated that they're not prepared to comply with the vaccination. You also gave a number, which I just didn't get, those who have not yet declared one way or the other. What number is that, please?
So through you, Mr. Deputy Mayor, that number is 68. So just to clarify, the 474 employees are those that are participating in the rapid testing program. So
Okay.
they are either unvaccinated or they haven't declared their status. The other
Okay.
68 have not participated in the program and have not declared their status. And so they've been placed on unpaid leave. They are not in compliance with the policy.
Okay.
Thank you, Councillor.
And just from a simple percentage on the basis of, I mean, I'm just going to round those numbers up around, 530, 540. What percentage of our workforce is that? I'm going to say minuscule, but it's still a percentage. Any idea?
Thank you, Ms. Fontana.
Through you, Mr. Deputy Mayor, that percentage is approximately 7%.
Okay.
93% are fully vaccinated. The other 7% are either not or haven't disclosed.
Okay. Thank you, Mr. Chair. I will have a couple of questions when we go in camera, legal questions. So put me on the list for when we're in camera. Thank you very much.
Thank you, Councillor. The next speaker is Councillor Jason Farr. Councillor.
Thanks, Mr. Deputy Mayor. And so, Laura, and just piggybacking off of Councillor Powers' study to this issue as it relates to the 7%, I guess what we have here by May 31st or June 1st, we'll really know the true number of our employees that just, are firm on anti-vaccine. I guess that's what's before us in a nutshell, correct?
Ms. Fontana.
Yes, through you, Mr. Deputy Mayor. Yes, I think by the time we arrive to May 31st, we'll have a good sense as to the number of employees that are absolutely not going to get vaccinated.
And not to put you on the spot, but I think you had mentioned that you were looking at our comparator communities on this prudently, and you said something to the extent that those who implemented this, whether they're in the municipalities or not, have had success in getting a lot of folks who've been on the fence vaccinated. Do you know the numbers and where these locations are?
Ms. Fontana.
So through you, Mr. Deputy Mayor, they're essentially the municipalities that are indicated in the report. In terms of numbers, they didn't share specific numbers with us. Anecdotally, they advised us that when the provision of termination of employment was introduced into their policies, or if they never introduced a testing component in their policies, they saw a dramatic uptake in vaccination status amongst their employee population.
So it's safe to assume then, Mr. Deputy Mayor, that we can anticipate same. And I think that's appreciated. I think we probably, as a council, convinced a lot of people to get vaccinated when we, I think we were the first municipality, Mr. Deputy Mayor, in the country to ask, or in the province to ask the province to consider a vaccine passport. So all the things connect to what was, through you to Laura, which you said an ultimate goal that was always 100%. And we were one of the first communities to have a vaccination policy. When was that again, Laura? And is it also safe to say that that was the statement to those folks right now, the 7%, that, we kind of give you a fair warning on this, and we've been, pretty good for the most part up until now. So safe to say, through you, Chair?
Ms. Fontana, please.
Through you, Mr. Deputy Mayor, I would say we're one of the fewer municipalities that have provided the longest runway to an ultimate goal of termination or an ultimate result of termination of employment. Our program, the report, as you know, was before council on August 26th. The testing program started November 4th, and we've been proceeding through the program until now, and a variety of reasons have arisen: the supply, the efficacy, the ability to continue with the program, and our ultimate goal again of having 100% full vaccination. By the time we get to the end of May, that will have been a very significant period of time to help our employees adjust to the acceptance of vaccinations, and understanding that we can't continue with the employment relationship unless they're fully vaccinated. So we did incorporate the testing program to allow for that time, to allow for that those provisions, and in an effort to preserve, I would say, our good labor relations with our union leaders, to have that runway so that folks can adjust to to becoming fully vaccinated.
And that testing program, as you say, when you make your comments about the science currently, and we may not be doing enough, so that may be enhanced, and I'm sure all of our union leaders are aware we might go from 2 days to 4, and they'll adjust accordingly, and everyone will, I'm sure, adjust accordingly. One last question, Mr. Chair. I forget, and maybe it's in the report, so Laura, I'm sorry if I missed it. Why are counselors exempt from this?
So through you, Mr. Deputy Mayor, counselors are exempt because they are not employees of the City of Hamilton. For this purpose, we do not have the authority to terminate members of council. Members of council, as you know, are elected officials, and they are voted by through their constituents. We do not have the authority to terminate members of council.
Thank you, Councillor.
I'm going to stew on that. Maybe there's a way, at least symbolically, we can show our support for the current policy. But I'll stew that over. I'm sure there's other questions, and thank you, Mr. Chair. Thank you, Laura.
If I can, I would say that symbolically, members of council have shown their commitment to the policy through their vaccination status, through the submissions of the proof of their vaccination status. They have
good point. So
they have complied with the policy in that respect.
Through you then, Mr. Deputy Mayor, as a subsequent, then we can confirm publicly that all of us are triple vaxxed or double vaxxed then.
Through you, Mr. Deputy Mayor, I won't confirm the numbers. So I don't want to disclose any private information, but that is the way that council can comply with the policy, is through their vaccination status, and providing the employee with proof of that vaccination status.
Thank you. Thanks, Mr. Deputy Mayor.
I do recall that we had 100% compliance with the 2 vaccination, which is excellent. Thank you. Next speaker, Councillor Tom Jackson.
Thanks, Deputy Mayor Clark. Never an easy time when we're talking about the livelihood of employees. Executive Director Fontana, and I know you above all are very thoughtful and sensitive to our workforce throughout your entire wonderful professional career. So let me ask a couple of questions, and then I'll have a couple of when we go in camera for legal. So on the very, very positive side, it's great to hear that 93% are double vax. That's a wonderful, great testament to our workforce. I want to zero in on the 474. The 68 on the unpaid leave, quite frankly, is a different kettle of fish. But I want to target and settle in on the 474 that you say up to now have been complying with the rapid testing faithfully. And to your knowledge, ED Fontana, they have not tested positive in any way, shape, or form. Obviously, there's no need to divulge private information, but from a collective standpoint, you get the gist of my question through you, Deputy Mayor Clark, to the ED Fontana, please.
Thank you, Ms. Fontana.
So through you, Mr. Deputy Mayor, since November 4th, we've had 25 employees test positive through the rapid testing program, and those individuals obviously were not permitted to attend the workplace because of those test results.
So overall, ED Fontana, the 474 have been complying with the council approved vaccination policy program if they weren't going to be vaccinated, to provide regular rapid testing since, what was it, early November. So over these 3 months, those 474 have pretty well complied through you, Deputy Mayor?
Ms. Fontana.
Yes, through the Deputy Mayor. Yes, for the most part, the vast majority of them have complied. We've had some issues with the tests, but the vast majority indeed have complied.
Thank you, Councillor.
Yeah, thanks, Deputy Mayor Clark. A couple subsequent questions. Edie Fontana, the last thing I want to hear sincerely is that we want to get out of this business because we can't afford $80,000. If I recall, through General Manager Zagaric last year, we have millions of dollars in COVID related cost reserves. Thank you to senior levels of government. So the last thing I want to hear sincerely is, you know what, Councillor Jackson, we just can't afford $80,000 if the province won't provide them free anymore. Through you, Deputy Mayor Clark, for a comment, please.
Thank you, Ms. Fontana.
Through you, Mr. Deputy Mayor, that is not at all, Councillor, the driving force for this amendment to the policy. We had contemplated the end of the testing program from the beginning. We knew that at some point in time we would have to deal with ensuring a full vaccination amongst our workforce. The supply, was a huge consideration. Our ability to secure adequate and reliable supply going forward. Again, the efficacy has always been a concern, and it's been an increase in concern because, as we know, the twice a week testing may or may not be sufficient. We have always prioritized the health and safety of our workforce, and again, the communities that we serve as paramount to the testing program. And we're finding that these reasons are no longer as effective as they were back in November. So the cost is part of the consideration, but I would suggest that it is not the driving force. It's one of the more least considered reasons for the proposed amendments.
Thank you.
And last
Councillor.
question, thank you, Deputy Mayor Clark. Last question, ED Fontana, and this is a hypothetical, but because the province had mused about this, I believe it was sometime before Christmas, that possibly they had mused about by sometime early this year, they may reconsider the whole mandated vaccination policy, depending on how society and the province were doing in terms of percentage of those vaccinated and the numbers of positive testing dwindling and decreasing to a satisfactory level. If we were to support the amended policy today, but the province were to change that, the province's overriding of the municipality then would cause us then to take another look. If we approve the policy today, that down the road, if something were to change from the provincial standpoint, overriding hypothetically, that would cause us to have a redebate and rediscussion. Through you, Deputy Mayor Clark, to whatever ED Fontana can provide on that, please.
Thank you, Ms. Fontana.
So through you, Mr. Deputy Mayor, yes, indeed, if the province were to change their position and in terms of mandating vaccines, we would absolutely come back to council for reconsideration. We are currently proposing and recommending these amendments, given the current state and the lack of, quite frankly, the direction from the province on these matters. But between now and May 31st, particularly if the province changed its mandate or if there are other legal provisions that we needed to be aware of that changed the landscape of these proposed amendments, we would indeed be back before council with those recommendations.
As always, Deputy Mayor Clark.
Sorry, Councillor.
Yes.
I see the
Yes.
city manager has popped up, so I'd like to defer to her, please.
Thank you, Deputy Mayor, and to all members of council through you. Just to confirm, the province hasn't mandated vaccination for workplaces. So they put in requirements to go into certain public places that you need to show proof of vaccination, like restaurants, recreation, etc. But there has been no mandate from the province for workplaces to put it in place. Certainly, there's been strong encouragement from the Chief Medical Officer Health and public health officials about workplaces stepping up and doing it, and but there is no mandate from the province.
Thank you, Councillor.
So City Manager Smith, thank you for that important information. So up to now, and I apologize, after 22 months, I guess I should have known this like the back of my hand. So I apologize. So the province has not, within their own thousands of employees, within their ministries and departments, they have not mandated vaccination to your knowledge through you, Deputy Mayor Clark?
Through the deputy mayor, I should, I'm not trusting my memory with what I'm talking about the province in terms of workplaces overall. In terms of the public service, I don't trust my memory on that one either. Someone else may be able to answer that. I was more commenting whether they'd mandated it in other workplaces.
I believe they mandated it in long-term care facilities, but I'm not aware of any other mandates. Ms. Fontana?
Through you, Mr. Deputy Mayor, in long-term care, and I believe for our paramedics, but not for the municipalities or the broader population.
So it was a narrow scope, Councillor. Go ahead.
Okay, thank you for all this. And just a summary comment, never an easy time. Again, Deputy Mayor Clark talking about the livelihood of employees that have dedicated their careers to the corporation. As always, Edie Fontana, whenever something like this very sensitive and delicate comes along, you always do your very best to build in a cushion of time so that um, somebody's way of life as they know it suddenly isn't ending, if you will, by the end of this week, that you've always built in as you did last fall and you're doing now with this proposed amendment to May 31st. So a couple of questions for the legal, but overall, again, I want to commend your sensitivity on this matter. Thanks, Deputy Mayor Clark.
5 minutes exactly. I don't know how you do it. Next up is Councillor Danko.
Thank you, Mr. Deputy Mayor. I have three trains of questions. First is, I heard earlier from question from Councillor Powers that 2 doses is considered vaccinated. So my first question is, originally my understanding of our vaccination policy objective was to prevent the spread of COVID. My current understanding with Omicron is that 2 vaccinations has limited effectiveness for spreading to prevent the spread of COVID. So my question through you is, what is the objective of this policy in terms of 2 vaccinations being vaccinated?
Thank you, Councillor. Ms. Fontana, please.
So through you, Mr. Deputy Mayor, again, it is an evolving science. So back in November, the 2 vaccinations was sufficient in terms of preventing, preventing COVID from the workplace. At this point in time, we don't have the science, as I mentioned, is evolving. It may be 3, and that's why we're losing confidence in our rapid testing program, because we no longer feel that perhaps 2 is sufficient. We continue to be guided by the public health regulations and guidelines. At this point in time, they continue to say 2 doses. At some point in the future, it may be 3 doses, or 2 in the booster, and so forth. I think that's one of the main reasons why we're abandoning the rapid testing program, because we no longer have confidence that indeed the two doses is sufficient, or the twice weekly is sufficient in terms of ensuring the health and safety of our workforce. But at this point in time, we are continuing with the guidance that 2 doses is considered full vaccination.
Thank you, Councillor.
Thank you. I guess what I'm struggling with is the objective of making this fully mandatory with threat of termination. If with Omicron and the evolution of the virus itself, if it's no longer effectively preventing spread, then is the objective of this policy different than what it was initially?
Ms. Fontana.
Through you, Mr. Deputy Mayor, no, I would suggest that the objective of the policy has been the same since the fall of last year, is again to protect the health and safety of our workforce. We are safer with the vaccines. If the Omicron is spreading with vaccinations, I think we're all aware that the symptoms are much milder. So we are trying to achieve the ultimate optimal health and safety of our workforce. The best way to manage that is through vaccinations. So I would suggest that the ultimate objective of the policy has not changed.
Thank you.
And
Councillor?
that is to our duty to provide a safe workplace and the health and safety of our workforce.
Ms. Fontana?
Exactly. Through the chair.
And thank you. And just so I'm clear, this policy is endorsed, recommended by public health and the chief medical officer of health for the city of Hamilton. I just want to be absolutely clear that is a public health recommendation.
Thank you. Ms. Fontana?
Through the deputy mayor, the vaccine verification policy has been endorsed by the medical officer of health in terms of the current program. But again, it's an evolving science and things change, so that landscape. But the ultimate, again, objective of protecting the health and safety of our workforce and the community we serve has always been endorsed by your medical officer of health.
And the current policy recommendations that are before us today are recommended by the medical officer of health for the city of Hamilton, just to be, so I am absolutely clear.
So through the deputy mayor, I haven't reviewed the policy with the medical officer of health. We have consulted with her team. In fact, we asked the director in terms of the efficacy of and the reliability of the tests, whether or not two tests per week was sufficient. And our advice was that in our population, actually three tests would be safer in terms of ensuring the health and safety of the workforce and preventing the spread of the virus.
Councillor?
Okay, thank you. Second kind of area of questions was that the rapid testing that employees have been doing to date, the 474 employees, is that a take-home self-administered test that they're then reporting the results?
Thank you. Ms. Fontana, what's the process?
Through you, Mr. Deputy Mayor, yes, we have been supplying these employees with the rapid test. They take the test in the comfort of their home, and then they take a picture of the results, and they submit it through our occupational health nurse and human resources.
Thank you. I guess I imagine a number of us have probably done a rapid test over the holidays, and it's much more complicated than I had anticipated. And I'm a little skeptical, I suppose, that employees are actually doing these and not just saying that they're doing them. So what assurances do we have that, in the interim period that they're actually doing it? Takes about a half an hour to do the test properly.
Ms. Fontana?
So through the deputy mayor, I'll start this question, and perhaps Matthew Sutcliffe can also pipe in, because I know he's been extremely engaged in this process. But there are codes that are submitted in order to support that indeed it is the test that was provided by the city. We have had cases where individuals have, for example, taken a picture of a test and then submitted on various occasions the same picture. And there are ways for us to monitor that and ensure that they are different tests on different days with different results. But the tests themselves, there are ways for us to verify that indeed it's the rapid test that has been issued, and that the results submitted are indeed current and valid.
Thank you. Mr. Sutcliffe, do you have something to add? I can't hear you, sir. You're muted. Sorry, we've caught you off guard.
My apologies through you, Mr.
There
Deputy
you go.
Mayor.
Perfect.
Thank you. I have nothing to add to that. Thank you.
Thank you. Back to you, Councillor.
Thank you. And just, I guess my concern with the test is the procedure for the test is actually very specific. It's like 10 turns in one nostril, 10 turns in another nostril, put it in the solution for 20 seconds, squeeze it out. Like it's quite a very specific procedure. So I'm not sure if you're already skeptical of vaccines and the whole COVID thing, that you're going to rigorously follow those procedures. So just a concern with that. My last question, if I still have time, is on the recommendation D that if tests are not available, that staff be placed on a paid leave. So my current understanding is that we have, 68 who had been placed on an unpaid leave. I'm really uncomfortable with the idea that we would be rewarding people who are refusing to do the right thing with a paid leave to stay at home, and why we would change that from the current policy.
Thank you, Ms. Fontana.
So through you, Mr. Deputy Mayor, the distinction here is that we are placing them on a paid leave of absence in the event that we're not able to provide them with the rapid test. So that is really dependent on the supply. And as I mentioned in the report, we don't anticipate any issues, any significant issues or delays with the rapid test. But if there's a day or two that we simply don't have the tests and we're not able to provide employees with a supply, that is of no fault of their own. And that is why we're suggesting that it's a paid leave of absence for those days, hopefully few and far between, when we're not able to test them. But again, that's of no fault of their own, and we don't want to penalize employees for something that's beyond their control.
Thank you. Council, you have 1 minute left.
Thank you. I'll listen to the rest of the discussion, but at this point, my thinking on the paid versus an unpaid leave is I would seek to change that to an unpaid leave. It is the fault of their own because they're refusing to report their status or just get a vaccine. So I have a real hard time with the 93% of our staff who have done the right thing. And then if we were to send people home on a paid leave because they refuse to do the right thing, that's just a terrible message. So listen to the rest of the discussion, but that's my thoughts on that for now. Thank you.
Thank you, Councillor. Well within your time. Councillor Pauls, starting now. Thank you.
Okay. And through the chair, thank you, Laura, for being here. I looked at Appendix C with all the departments and the division and the rapid antigen test. My concern is the services that are especially affected are the fire department with 57, 11 paramedics, and medical officer of health, 24. I am just so concerned about that. And the reason is this. If we mandate this and we do not accommodate them, they have served us as well. They kept our city safe for all these years. Even with COVID, they worked. I'm just wondering what would happen to our city, the safety of our city. And I just saw Stephanie send that 64 members of the public service in Ontario must be vaccinated or take regular COVID-19 tests. I'm just wondering, have you talked to the unions? What are they saying?
Thank you. Ms. Fontana, please.
So through you, Mr. Deputy Mayor, so yes, we have talked to the unions. I've participated in a couple of those meetings, particularly QP 5167 administration, inside outside workers, and also our ATU, our transit union. And they have received the information. Can I say that they're happy about it? No. They want to have further conversations. I would say they understand the situation. I think most of them prefer that all their members get vaccinated, but they're also in a situation where they need to represent all of their members, including those that are unvaccinated or refuse to disclose. Some of the suggestions that were provided were, we'll just abandon the testing program and just allow people to come into work and continue to demonstrate proper protocols, proper health and safety protocols. That's not sufficient for us in terms of ensuring, again, the health and safety of our workforce. The second part of your question in terms of the services, we have spoken with the leaders of these divisions. So for example, fire, transit, the public works, they're aware of the implications. They have these numbers. They know the potential implications on their services and are prepared to respond to it and ensure that the services are disrupted as minimally as possible. So the numbers are out there. We're working right now with reduced employees, even as a result of the absenteeism, COVID-related absenteeism. So we are managing through it. Again, the senior leadership team is aware. The leaders of some of these hotspots, I would say, are also aware of the potential implications, and they've indicated that they're able to work with it.
Thank you, Councillor.
Yes, and I look at the situation and I see 93% are vaccinated, which is fantastic. I remember we used to say when it's 80, we're, doing well. Now we're 93. And, I want to speak with my heart at this time. I've had calls saying, they work through it and there are reasons why people are not taking it, but we have to be clear. Whether you're vaccinated or not, or third, you could still spread it. You could still get it. My mother-in-law got it the third time, and she's been vaccinated 3 times. Like, it's not that it's foolproof. And I'm just saying, yes, I'm vaccinated. I made the choice. So in my heart, I think we should accommodate that 7% that's so crucial, especially when I look that most of them are in the 911, like medical officer of health, 24. Like, so that's my thought. And we have to be clear that we don't tell the public, yeah, you're fine, you're vaccinated, go out. We can't do that. Whether we're vaccinated or not, we still have to be careful. And so I'm just would love to know why these people are not getting vaccinated, especially the medical officer of health. So I'm just wondering if you think that, or council, if we could come up maybe with another solution.
Ms.
And
Fontana?
till May's a long ways. Maybe by the spring, Omicron is gone and everything is fine. Could there be a time of waiting where we can figure this out and accommodate these people?
Ms. Fontana?
So through you, Mr. Deputy Mayor, I would suggest that we have been accommodating these people, this 7%, quite frankly, through our rapid, testing program. While I do empathize with the, how people feel about vaccinations and their reluctance to do so, and this is really more of a commentary, I suppose. But I also want to recognize and respect the 93% that have been vaccinated. They are doing their part, in my opinion, in terms of ensuring the health and safety of our workforce in our broader communities. So I think we have accommodated. I think we have allowed enough time. This COVID virus, regardless of the variants, are not going away. I'm not hopeful that it's going to go away anytime soon. And we have to do our due diligence. And I think we've come to a point where we need to make decisions. There are alternatives in the report, Councillor Pauls. I'm not particularly supportive of the alternatives, but certainly something we can consider. I would suggest we're at a point where we need to, we need to stop the testing program and move on with what we need to do.
Thank you, Councillor. And before you proceed, we should clarify, because I think you said the medical officer of health
No,
is
no, I
the one.
said
You said the medical officer of health. I think you meant to say public health staff
it
reporting
says
to the medical
medical
officer.
officer of health on mine. I'm sorry, it says 24 medical officer of health.
Okay, we need clarification from the city manager because we don't have 25 medical officers of health.
It says 24.
Thank you.
My apologies. If I can, that should say through the chair, that should say public health.
Thank you. That's what I thought. Thank you. Thank you. Okay, sorry about the interruption, Councillor
It's
Pauls,
all
please
right.
proceed.
I will ask some questions in camera
Yes.
and I'll look at the alternative. Thank you very
Okay.
much. Thank you, Laura. You've always been a great help to me. So thank you.
Thank you very much. Mayor Eisenberger, first time speaker, please.
Thank you. Yeah, difficult, challenging issue, and you know, to that last point, it's our medical officers of health. I can assure you is fully vaccinated, but you know, we have run this by all of our senior leadership team. To my understanding, Laura, you can confirm this, that they are all very supportive of moving in this direction. All fully understand the implications of their employees and the challenges we're already facing, and believe that all of that can be managed. So just to be clear, Laura, I think you need to clarify that the senior leadership team has had a good, hard, thorough review of all of this and are 100% behind this action.
Ms. Fontana.
Yes, through you, Mr. Deputy Mayor. Yes, indeed, SLT has thoroughly reviewed the report. We've had some very candid and frank conversations in terms of the direction. They understand the implications, particularly as a result of the staffing issues resulting from the recommendations. Some of the leads, for example, the fire chief, the paramedic chief, the transit director, they're aware as well of the report and the implications, and they are supportive. And I mean, if they are here in attendance as well, they can certainly speak to their respective departments and services. But I can assure council that we've had hearty discussion on the report and the implications, and they are fully supportive of the direction and recommendation before council today.
Thank you.
I appreciate that. I think that's important information. So, and you know, in terms of you know, have we been accommodating? And I would say that we have been more accommodating than most municipalities in the province that I'm aware of. Many of them, most of them actually built in a termination date right at the outset of their mandatory vaccination policy, as I recall it. And I think Toronto was certainly in the lead in all of that. And many of them have already enacted that, as have our hospitals, in a very significant way. Actually made the very same policy and direction, and have terminated individuals that have not adhered to the mandatory vaccination policy. And again, not a question, but just a point, and then I'll stop. We have a responsibility to the 90+% of our employees that have done the right thing on behalf of not only the organization themselves, their families, and our broader community. And you know, I don't know that that absolving the other 7% and saying, well, you know, everyone else has done it, but yeah, you really don't have to. Don't worry about it. Is not a scenario that I'm going to be able to support or buy into. And I think we have that health and safety responsibility, no matter what those 7% of people decide to do. You know, at some point, we are going to we're going to bring people back to the workplace. And that is going to be a much more challenging scenario if we haven't mandated vaccinations for everyone, because those that are then vaccinated are going to be making the challenges that some of the unvaccinated folks are making right now, that their rights are being infringed upon. They are going to provide legal challenges, and I'm sure you're going to hear some of that in the kind of the legal brief that we're going to hear in a moment. So let me just kind of give you that preamble. I fully support what staff is bringing forward. As difficult as it is, it's probably long overdue. We've given it a lot of runway, and still are giving it a lot of runway. May is, you know, fully 3 or 4 months away, so there is ample opportunity for those that, for whatever reason, have decided not to declare or have just refused, and are, you know, doing the testing regime. There's ample opportunity for them to take the vaccine that everyone else has benefit from. And that is required if you're going to work at the City of Hamilton. Right now, though, just to confirm, Laura, in our hiring process, are we allowing anyone that is unvaccinated to be hired into the City of Hamilton?
So Through you, Mr. Deputy Mayor, no, it is a condition of employment now. In order to be hired with the city of Hamilton, you have to be fully vaccinated.
And that is a policy that was fully approved by council.
Ms. Fontana?
Yes, through the deputy mayor. Yes, through the deputy mayor. It was part of the report that we presented back in August.
Great, thank you. And, well, thank you. And I know it's been agonizing work for all of HR and Laura and everyone who have been nothing but compassionate and caring and concerned about all of our employees, and that will never stop. And I do appreciate the heartfelt approach that we've taken here in terms of accommodating individuals and giving them every opportunity to do what 90+% of the population has already done, which is the right thing: get vaccinated, protect our community, protect our healthcare system, protect yourselves and your families. It's the right thing to do, and I think we should have a policy that will require that. So I'm looking forward to enacting that a little later on. Thank you, Laura, and thank you, Mr. Chair, for the brief words, and I look forward to the in-camera legal advice that I'm sure is going to be helpful.
Thank you very much. Mr. Mayor, would you mind taking the chair? We're out of first-time speakers, and I have just a couple of questions.
More than happy to, actually. Councillor Jackson is the previous deputy mayor, so more appropriately, I think he should take the chair. Actually.
Perfect. Councillor Jackson, you take the chair for me, please?
Sure, I'll do it. Go ahead.
Don't ponder it. Just thank you. And I don't know who to ask this question to, acting chair. The the Healthcare Consent Act talks about informed consent. And the province, to my knowledge, has not changed that act and has only mandated vaccines to long-term care facilities, and I guess the paramedics was the other one. So I'm trying to struggle with why we would be jumping into a position where we're going to be terminating people because we're mandating vaccinations when the province, and it's rightfully so within their sphere of authority, has not done so. So have I misstated something? Has that Healthcare Consent Act been changed by the province? Have they mandated vaccines right across the board to help municipalities? Because we will get grievances and we will have hearings and costs because the province didn't do their job.
Executive Director, I'll start with you, please.
So yes, I'll start, and perhaps Stephen Spracklen would also like to comment on the response. From an employment perspective, we're governed by the Occupational Health and Safety Act, and in that respect, we have to provide a healthy and safe work environment, and that is what we are governed by. I know there is an absence of case law, and particularly in response to the lack of direction coming from the province. It's left us making some of these decisions without proper guidance or legal parameters. But from our perspective, we have been guided by the Occupational Health and Safety Act primarily, and the Ontario Human Rights Code.
Thank you. City Solicitor, any further comment to that, please? And introduce yourself for the first time, please.
Yes, thank you very much, Acting Deputy Mayor Jackson. It's Stephen Spracklen, City Solicitor. Through you to Councillor Clark's question, I am not aware of any changes to the Healthcare Consent Act, nor am I aware of any changes to any other provincial legislation that would provide for a government mandate with regards to vaccination. There have been changes with regards to some occupations in the vulnerable sector, and I think we've talked about long-term care and paramedics, but other than that, an overarching policy statement and mandate has not occurred to my knowledge.
Thank you for that, Mr. Chair. So would it be appropriate then for the municipality, because we are going to have, I would suspect, grievances coming forward on this, would it be proper for us to use COVID funding to assist us with those hearings and those costs?
City Solicitor or Executive Director? If the question's understood.
Through you, Acting Deputy Mayor Jackson, to Councillor Clark. The question with regards to availability of funding is one that I would want to ask my finance colleagues to comment on. I believe that there are a number of criteria that are necessary to be satisfied before we can access provincial funding, and whether or not this would meet that criteria, I'm not 100% certain.
So Chair, why don't we leave that as an open-ended question and staff can look into and get back to us? Oh, I see Mr. Zagaric popped up and he popped away now.
Would you like him to chime in if he's popped back in?
If so, or he may want to take the opportunity to review it and get back to us.
General Manager Zagaric, welcome. Happy New Year. Introduce yourself for the first time.
Happy New Year. Mike Zagaric, General Manager of Finance and Corporate Services. And as Councillor Clark suggested, staff will take that away. There is a particular program, provincial program. It's a municipal recovery program. So we will examine the parameters of that funding program regarding the eligibility of the program costs that committee are deliberating on. Thank you.
Oh, thank you. And so then my last question would be, has there been any municipality where they have gone to the board with grievances and they've had hearings and they've lost those applications?
Executive Director, that be in your bailiwick, please.
Through the deputy mayor, to Councillor Clark. To the best of my knowledge, I haven't seen any case law or any arbitral decisions specific to terminations. There have been decisions with respect to the reasonableness of a policy, and we saw one recently, even locally at Bungie Company here in Hamilton, and the arbitrator ruled that it was a reasonable policy to require employees to be vaccinated. I think Toronto, quite frankly, is the first one out of the gate in terms of termination. They did terminate a number of employees in early January. I think the jurisprudence in case law is going to evolve over the next few months, and we'll hopefully have the benefit of knowing that as we move forward and make ultimate decisions and further decisions down the road in terms of the employment of, and the management of our staff.
Thank you for that. And those are all my questions. I can take the chair back. Councillor Jackson, thank you for your assistance. We have two second-time speakers, Councillor Farr and Councillor Wilson. Councillor Farr,
thank
please.
you. Thank you. All good questions. And Mr. Chair, appreciating what I think Councillor Jackson had said earlier. Not easy. Ultimately, May 31st, we will obviously be dealing with a number. It'll be, I think, significantly less than 7% of our workforce, but it'll still be a lot of people that want to hold firm. And I agree with you and appreciate Laura's retort on the legalities of everything. It seems to be as fluid as that conversation as the virus itself. But the Bungie example is a really good one. And there's a company that actually leases property from the port, which follows another level of government's policy that is, it's apples and oranges compared to what the feds are doing in the province. So I just wanted to, and I think you had asked a question if staff could come back, Mr. Deputy Mayor, as well here. I'm not looking for quick math, but on Appendix C, if we could get a breakdown email to us down the road when available of the percentages per department. That's not there. So we don't have ultimately that info. I'm curious about it personally, and I'm not in a big hurry to get that. Otherwise, Mayor Fred covered the other couple of questions I was going to ask. So thank you.
Thank you. Ms. Fontana, can you get back to us at a later date with those percentages?
Through you, Mr. Deputy Mayor, indeed I will.
Thank you very much. Thank you, Councillor. Any further question? Nope. Perfect. Thank you very much. Well within your time. And Councillor Wilson.
Thanks, Deputy Mayor. Just 2 points of seeking clarification. The definition of fully vaccinated, Director Fontana said any new hires must be fully vaccinated. Do we define fully vaccinated to be boosters and then continuously being boosted, etc.? Thank you.
Thank you. Ms. Fontana.
So through you, Mr. Deputy Mayor, at this point, we consider fully vaccinated 2 doses. And again, we are following the guidelines provided by public health. So the boosters is not part of the consideration at this point in time. I understand, I think the long-term care, there is a change in definition effective January 28th, where the booster would, for example, be considered then those working in long-term care would require the booster in order to be considered fully vaccinated. So it would depend on, again, the legal requirements, and then it may be sector to sector differences depending on what is being defined by public health as being fully vaccinated.
Thank you. Councillor Wilson?
Thank you. And just so I'm clear, there was reference to a strong endorsement from senior management. Does that roundtable include the Chief Medical Officer of Health?
Ms. Fontana?
So through you, Mr. Deputy Mayor, Dr. Richardson doesn't sit on the senior leadership team, but the general manager of Healthy Safety Community does. And there is consultation and collaboration between those two. And I suspect that conversation has happened, and Dr. Richardson is aware of the policy and the recommendations.
Councillor?
Well, forgive me. Being aware of the policy is one thing, endorsing it is another. Are you able to comment on that?
Ms. Fontana?
So through the deputy mayor, I'm not able to comment on that directly. Perhaps Ms. Smith or Grace Mader could comment on that.
Thank you. City Manager Smith, can you enlighten us?
Yes, through the deputy mayor to members of council. So Dr. Richardson, if you'd like to hear directly from her, would be able to join in after we have the in-camera discussion. She's just on an urgent meeting with the chief MOH. What I can say is, but I appreciate you want to hear directly from the MOH. She has given advice to the EOC that the testing and rapid tests should be prioritized for those high risk settings, especially as supply is short. She has promoted, as well as the chief MOH and others, that individual workplaces should develop their vaccine policies, and that she continues to promote vaccination as one of the very important public health measures in the pandemic. But I just got off the phone with her. She's just on that call, but believes she'd be available at 1 o'clock. So perhaps after we go in camera, she'd be available.
I think that would be helpful because I think there's a degree of trepidation from councillors in terms of whether or not she supports the termination policy. So if we could make that happen, that would be great. And we go back to Councillor Wilson.
Thank you. And further to your questions, Deputy Mayor, I think as usual, you are being diplomatic in referencing the province in this regard for, I think you used the term lack of direction. I would say it's a lack of leadership. We cannot have a jigsaw puzzle approach to an epidemic. We cannot, in my opinion, leave it to the leadership of each individual hospital to come forward on something that knows no boundaries and does not discriminate in terms of age. So regrettably, it's left to individual municipalities to work their way through and left to individual hospitals to work their way through with policies. And I think that should be a concern, continued concern to all of us. Thank you.
Thank you, Councillor. I have a couple of other second-time speakers. I have Councillor Jackson, please, second time.
Thanks, Deputy Mayor Clark. I really want to thank Councillor Danko and Wilson. I just found it a little bit puzzling that we just couldn't get a blunt, straight answer that our MOH is fully supportive and endorsing of this amended policy. So I'm not standing in judgment, but when Councillor Danko started and then Councillor Wilson, I think they were both just looking for a nice straight answer and didn't seem to get that. So it'd be nice to hear directly from our MOH that she does or doesn't support this amended policy. Deputy Mayor Clark, I just want to thank also It was a question about the provincial employees. I just want to thank Elsie Paparella how quickly she did some research for us and shows that Ontario says all 64,000 members of their public service must be vaccinated or take regular COVID-19 tests. Elsie Paparella, very important to know, because I just thought it would just be so bizarre and odd that municipalities have mandated it, and yet the provincial government said, yeah, that's okay, we're on our own, we're doing something different. Thank you, Deputy Mayor Clark.
Thank you, and we should try to clarify whether or not they have a termination clause also attached. Mayor Eisenberger, you're a second-time speaker, please.
Yeah, thanks. Throughout the pandemic, we certainly have had the province leave a lot of the more challenging decisions to local municipalities. So this one is no surprise, quite frankly, and whatever their reason is. So that's an issue, and I do want to speak to, it's not necessarily the medical officer of health's mandate to look after our HR, employee issues. So I want to be careful that we don't put her in a kind of an awkward situation. Also, I'm sure she will answer in her own words and in her own way, but our leadership team relative to our employees are 100% and fully supportive. My only comment, Mr. Chair, was also going to be that I know you're probably contemplating a break at this point, and it might be worth our while to break before we go into camera. Um, I suspect that the in-camera portion is also going to take some time. So just a suggestion that this may be an appropriate time to go in camera on that issue, or do we have remaining issues to deal with?
We have two items, and then we can go in camera, I believe.
Okay.
So again, I will take your advice. Thank you very much, sir. Okay, any other questions or comments on this item prior to going in camera? Seeing none, I do need a motion to defer this item until after we come out of in camera, moved by Mayor Eisenberger, seconded by Councillor Jackson. So that'll be our first vote here.
Councillor Wilson, I'm sorry, are you able to vote? Thank you very much.
Thank you, and that carried unanimously. And point one, we have a motion, a donation agreement between the City of Hamilton and the Nikola Tesla Educational Corporation. And I'm looking for the mover. I think it was Councillor Powers.
It is.
Thank you, Councillor Powers. If you would like to put your motion forward, or is it a notice?
No, it is a motion. It's properly circulated in time. It's a motion moved by myself and seconded by Councillor Pearson. I can read it in entirety, but it's there in print form. It's basically to acknowledge the donation agreement between the City of Hamilton and the Nikola Tesla Educational Corporation respecting the Hamilton Electric City Public Art Project. I can speak to it, but I believe it's self-explanatory, and Ken Coyne is here from city staff if there's any particular questions.
Thank you, Councillor. And I missed the seconder. My apologies. Councillor Pearson.
Councillor Pearson, correct.
Do we have any questions or comments with regards to the motion? Seeing none, let's have the vote, please. Up now. And the vote carries 13-0. Madam Clerk, do you want me to read? There are no notices of motion, so then we'd be getting into general information. You want me to deal with that now, or?
Dear Mr. Deputy Mayor, it would be easier if we dealt with it now, then we recessed, and then we'll go into close when we come back.
Thank you. Amendments item 13.1 is the amendments to the outstanding business list. May I have a mover and a seconder to put 13.1 on the floor? Moved by Councillor Farr and seconded by Councillor Pearson. Any questions or comments about the outstanding business list? Seeing none, let's have the vote. Oh, Councillor Pearson, did you have a question? No, thank you. And the vote is up.
Counselor Wilson? You able to vote? Thank you.
Thank you, and that vote carries. 1:15 makes sense to everyone coming back to the meeting. 1:15. Councillor Pearson?
Chairman, thank you. Just for the record, I do have another meeting at 3 o'clock. I know we'll be going in camera, but I need the public to understand that I will vacate and leave this to go to another virtual meeting, and hopefully we'll be able to return. 3 o'clock today. Thank you, sir.
Thank you very much. I need a mover and a seconder to recess. Moved by Councillor Powers, seconded by Councillor Jackson. And so if we can come back at 1:15, that'll give us time to stretch our legs and get a quick snack and recharge the batteries. I appreciate your cooperation. Thank you.
Counselor Pauls? Carries 11-1.
Thank you, councillors. I give the microphone back to the right position. Councillors, we are back and we are now live. I need a mover and a seconder to go into a closed session, moved by Mayor Eisenberger. Sorry, I'm getting redirected. Go ahead.
Sorry, that was my happy dance. Could we just approve the minutes in open session while you're,
Oh, sure.
please
We
and
can do
thank you.
that. Item 14.1, mover and a seconder to approve the closed session minutes, moved by Mayor Eisenberger, seconded by Councillor Farr. December 10th closed session minutes as presented. And the vote is up.
So I'm just marking out those that aren't in the room.
Mm-hmm.
Oh, we didn't have quorum, so something.
We're short by one.
We're short by one.
Councillor Partridge is not on there.
Okay, let me see. I have to mark everybody back in. That's okay. Give me just 1 minute, folks. I need to mark some of you back in. Councillor Vanderbeek's there too. And Paul's Councillor.
So we were in the middle of a closed session minutes approval. And the vote's back up. This is to approve the closed session minutes.
Councillor Mula, if you don't see your vote, just give me a thumbs up. Thank you, sir.
And that's carried 11-0. Thank you. I need a mover and a seconder to move into closed session. Eisenberger and seconded by Councillor Farr. To move into closed session respecting item 14.2 pursuant to section 9.1 subsections D, E, and F of the city's procedural bylaw 21021 and section 239.2 subsections D, E, and F of the Ontario Municipal Act as amended as the subject matter pertains to labor relations or employee negotiations, litigation or potential litigation, including matters before administrative tribunals affecting the municipality or local board, and advice that is subject to solicitor-client privilege, including communications necessary for that purpose. And we'll have that vote now. Thank you, Madam Clerk.
You're welcome.
Members of the public will continue following the closed session portion of the meeting when you see the members of council rejoin the meeting. A reminder to all members of the committee to please ensure that you move into the closed session portion of eScribe. That's where you'll find the reports. Before we move into closed session, I would ask all members of the public to please exit the WebEx meeting, as well as any staff that are not directly related to item 14.2. They're also asked to exit the WebEx meeting. Madam Clerk, I'll leave it to you to tell me when that has occurred.
Okay. So I just want to make sure that all the staff that are currently in there are required to be in there.
So Stephanie, is Jeanette here? I can confirm that the general managers should stay in and legal, but none of the directors are needed or chiefs.
Okay.
The other one, Matthew Sutcliffe, should stay in as head of labor relations.
Okay, so
the directors would
I
only be able
we're
to speak to operational impacts, and that should be discussed in public.
I think we're okay though. I think we're okay now though.
Stephanie, I'll let you know that Leanne Fioravante, Larry Tansley, and Michael Kine from the legal team are present as well, because all three of them were instrumental and helped guide us on this issue as we work through it with the leadership team in HR.
Perfect. And I have Chief Cunliffe in here as well as Matthew Grant. So I think we're okay.
I confirm, please, that we are no longer broadcasting live. Now we go back to 10.8.
Give us 1 second, folks. We're about to go into open.
Sorry, I'm just talking out loud.
Just give us 1 moment.
Yeah. You. Perfect. Councillor Whitehead, nice to see you, sir. Hope all is well at your end. Good.
Okay, you are back in open session.
Thank you very much. We are back in open session to deal with amendment to the mandatory COVID-19 vaccination verification policy, which is item 10.8 in our agenda. Madam Clerk, actually, I'll go to, I think it was Councillor Farr. You had a question about the language on one of the clauses. There we go. Is that the change?
Dear Mr. Deputy Mayor, that is the change. The way that it currently stands and the way that it's worded right now would just be taking members of council out. However, I do just need to clarify a point. The way A is currently written, it also removes members of council appointed committees, but that was circulated to them and they are currently abiding by that, or it's currently applicable to them. So if they no longer want the council appointed committees to follow that, then we'll need to make a change.
Thank you. And we had movers and seconders for item 10.8 already. So 10.8 is open for discussion around the table. Mayor Eisenberger, please. There's only 3 of us on the top of my screen, so I'll pick you.
Thank you, and I
You
did have
still shared your screen. Oh, sorry, Mr. Mayor.
Oh, go
My
ahead.
apologies.
I did have my hand up in any event. And
Go ahead, sir.
I do appreciate the policy, and I know that there were some questions for Dr. Richardson earlier on, and I think maybe this would be the appropriate time to have that question turn to her. So I'd be happy to do that on behalf of council. I think Dr. Richardson, the question was, are you supportive of the direction that HR is advocating for from a public health perspective?
Thanks very much, Mr. Mayor. And hopefully you're able to hear me okay. Just sitting back into meetings, sometimes it doesn't connect properly. So, when you're looking at these issues, we've got 2 sorts of pieces at play, I would say, and then an overarching sort of framework. So one is just around vaccination in general. So you've heard me talk many times about the importance of vaccination to the control measures and to the control of this pandemic. So ensuring as many people as possible are vaccinated is absolutely critical as we go forward. And indeed, on Monday, you saw from the Board of Health presentation how that also benefits the people who are being vaccinated, that is the case. You've also heard when it comes to testing that these are a very limited resource, and particularly the RAT tests right now, as well as PCR tests. And so they are very much being prioritized at this moment for the settings that need them the most, the hospitals, the long-term care homes, other congregate settings where they're needed. And so that is definitely a challenge as well. The other piece to know is that a letter of instruction that I issued back some time ago now, I can't remember the exact date, did require all workplaces to develop an immunization and vaccination policy for COVID-19. And so it's in that framework and suggestions about what could be contained in that framework that this policy would also fit as well. When it comes to the specifics as to the content of a policy, that's a role really for the administration of the organization, and hence we provide them with the framework, we provide them with resources in terms of developing that policy, but we don't comment specifically on an organization's policy as it goes forward. Those decisions have to be made within the context that this one is being made and within the restrictions that apply. So SLT has appropriately considered those items and then made recommendations forward to council.
Mayor Eisenberger?
which I thought was going to be your answer, because it doesn't fall under your jurisdiction to make decisions on behalf of HR and our kind of civic organization. And there's a distinction between your role as medical officer of health and the administration at large. So I respect that. I know others might dig in a little deeper, but I'm not going to. On another matter, another question to Jeanette Smith, and thank you, Dr. Richardson, for your answer. On other municipalities that have enacted termination clauses, I've identified a few that I've shared with members of council. Burlington just recently did, and they have about 71 individuals that are impacted by that, not yet terminated. Toronto has enacted that policy quite some time ago, probably when we enacted ours, but they had a termination clause built into it, and have released about 446 individuals. I did mention Windsor that terminated 43 individuals as of January the 2nd. And Guelph has a termination clause, as does Mississauga, and have not yet terminated, but are heading in that direction. Oakville has a termination clause and has terminated 12. And my question is, Madam Clerk, or Mr. Clerk, or Mr. Chair, through our City Manager, Jeanette Smith, are you aware of any other municipalities? I'm thinking Niagara, other municipalities in Niagara as a whole, that you're aware of that have a termination clause built into their mandatory vaccination status, and have they enacted terminations as yet?
Thank you. City Manager Smith.
Through the Deputy Mayor, sorry, I'm looking over at my summary on my other computer, because I do keep in touch regularly, particularly in the GTHA municipalities. And, it is fair to say everyone's a bit different. Some have had testing, some have had not. What I can say, in addition to what the mayor has mentioned, Niagara region did put a vaccine verification policy in place without a testing requirement, and only for bona fide medical reasons. Their termination date is February 14th, and right now they have about 70 staff. Now, in talking to my peers, they certainly say as the date gets closer to that termination date, they find their numbers decrease. And some, they have said right till midnight the day before. So I would suspect we will see that our numbers would come down if council approves this policy. Just scrolling through, Durham has a policy where they have a number of staff. They are putting them on an unpaid leave for about 6 weeks first, as a last chance to get compliant, and then they follow with termination. So everyone's slightly different. I would also add, I think from our local media, that some of our other major institutions in the city, specifically Hamilton Health Science and St. Joe's, has put this in place and have had to terminate some employees as well.
Thank you. And just to kind of deal with the issue of the senior leadership team, there's been some, obviously there's an obvious concern about the impact on organization as a whole, as well as specific areas like fire, paramedics, public health, public works. You've communicated and have had the senior leadership team review all of these implications and all of these potential I just lost my words. You've had them reviewed. They're aware of the implications. They're supportive of the direction that we're taking. Believe, not to put words in your mouth, that we can manage this process based on the current numbers that we see. But we're all, of course, hopeful that we get nowhere near the 470 individuals that they come around to vaccination, and that impact isn't going to happen. But notwithstanding, we have to plan for the worst and hope for the best. They're comfortable that they can manage their operations effectively, efficiently, safely given the parameters that are in front of us right now.
City Manager Smith.
Yes, through the Deputy Mayor. Yes, we've not taken this policy change lightly. The senior leadership team itself has had a number of discussions, and our solicitor has been part of them as well as Matthew Sutka from Labor Relations. We specifically looked at all the program areas where we had staff participating in the testing program. We asked each of the operations directors, especially the ones that had, didn't just have one or two, to look at the impacts of that. They also considered issues such as, the current illness rate in their programs, and they all fully said that they could manage it. They supported moving forward in this policy and did not raise concerns. I don't know if they're back on the call now, but they certainly, I think they are, were available in public forum to speak to their specific programs as well.
Thank you. Mayor Eisenberger.
Okay, thank you, and I appreciate that, and I'm supportive of the direction that we're taking. I'm obviously unhappy with the circumstance we find ourselves in this particular instance, and very unfortunate that some have decided not to participate, as the vast majority of our population has decided to do for all the right reasons. And so some encouragement, I think, needs to apply here, and I'm fully supportive of that direction. The one issue that I still have outstanding in my mind that was raised by Councillor Danko earlier is, and I'm not clear on the language around any exemption for members of council. And I think all other members of council have indicated their vaccination status to HR, and I believe there's 100% compliance on that. But notwithstanding, the current recommendation exempts us, and I think it ought to include some sort of inclusion of members of council and members of committee that we appoint. And maybe that's done through code of conduct. And the language that I saw drafted by Stephanie wasn't clear to me, so I'll certainly want to see some conversation around that to ensure that we are not exempting ourselves, but that we are participating as fully as possible under the law. Given that, I think the sanctions are the only approach that can actually rightfully occur for members of council and those that are appointed by us. And I'm fully supportive of that. I just don't know what the language is in terms of this recommendation that actually flushes that out. But beyond that, I fully support the staff recommendation, and I hope that members of council will give it the full support as well. It needs a strong indicator to our staff on behalf of all those that have done the right thing, that have vaccinated, like you and I and everyone else that is concerned about not only themselves, but their family and the community at large, and our corporation, in fact, and keeping our economy buoyant and active and moving forward, and not putting our healthcare system into crisis. So, we all have a role to play in that, and each individual has a responsibility to participate, in my view. And I think this, for this corporation, is the right direction for us to take to encourage that to happen. Thank you, Mr. Chair. I appreciate that, and I'll look forward to some. I'm sure others have some thoughts on language that might appropriately address members of council and those that they appoint in the appropriate way.
Thank you. I have three speakers, Councillor Danko, Councillor Farr, and Councillor Partridge. Elsie Paparella.
Through you, Madam Deputy Clerk, did you want me to put the wording up? There are two options, so when you're ready, I can certainly put the wording up and explain it.
I think what we might want to do is go through the first round of speakers and then put up the language. We might get some other insights that might even improve the language. Councillor Danko, you're up next, sir.
Thank you, Mr. Deputy Mayor. My first question, I guess, is for Dr. Richardson as our Medical Officer of Health. As we heard earlier, the current definition of fully vaccinated is what's defined under this policy as 2 doses. It's my understanding that because of the evolution of the virus over time with the Omicron variant, that 2 doses currently provides limited protection against spread of the virus, but there is still a public health benefit to those 2 doses of vaccine. Can you just confirm, in terms of this policy that's before us, what is the public health value to those 2 doses of vaccine?
Thank you. Dr. Richardson, please.
Through you, Mr. Mayor. So in terms of 2 doses of vaccine, that is the current definition of fully vaccinated. That may change over time as we move forward through the immunization campaign and come to understand better what may happen. And so what we are seeing with the immunization level that we have now, yes, there is transmission that can occur amongst those that are vaccinated. That this virus isn't as well controlled in terms of transmission as we had seen to some extent with Delta, with the current levels of immunization. And so as we go forward, we are seeing that there can be a shorter duration of illness. There can be a less severe illness, which may help in terms of viral shedding and transmissibility, but it certainly is not having the impacts that it had before.
Thank you. Councillor Danko.
Thank you. And your recommendation through the framework that was mentioned to all employers, City Hamilton included, is that it's recommended to have policy for full vaccination of employees.
Doctor?
So the outline is to have a vaccination policy and to look at where things are at and keep that up to date at the time. And so it would recommend having full vaccination as part of that, because that is the utility ultimately of the vaccine itself. So if one weren't to be fully immunized, you wouldn't have the usefulness of the vaccine otherwise.
Thank you. Follow-up question to staff, perhaps the city manager, is that the vaccination framework, policy framework that that public health has provided was taken into account by senior leadership and evaluated, and it's felt that the recommendations that are before us today are the best way to ensure that we have a safe and healthy work environment for our employees. I just want to be absolutely clear.
Doctor?
I think it was to me, Deputy.
Okay.
Mayor.
Sorry.
No problem. Thank you. Through the Deputy Mayor. Yes. So we take in the advice from our public health, this case, our medical officer of health, as well as advice from our occupational health and safety experts within HR. And based on those 2 things and what we know today and the experiences we've seen in other municipalities, because we all have different types of policies, after a lot of discussion, it had to happen quickly because of the testing shortage, but this is wholeheartedly what the senior leadership team is recommending.
Thank you.
Thank you.
Councillor?
Separate question, or I guess more of a comment, is just on section D of the recommendations before us today for paid leave. For in the absence of testing, that those that refuse to disclose their status or refuse to be vaccinated, we will be placed on paid leave. My preference is, and I understand there's some complexity to this, but my preference would be absolutely to just simply maintain the existing policy, which is to report or test. And if testing is not available, vaccines are available. So I would ask that there be a separate vote on D or consideration to changing that to unpaid leave. And then just finally on the language for removing the exemption from council, I think it's our duty that as councillors that we lead by example, and we're not exempt from this policy. And I think there's a fairly simple way that we can just refer any violations to the integrity commissioner for sanctions, because we would be in violation of official city policy, which would be an integrity a code of conduct violation, and I think there's a fairly simple way that can be dealt with. So those are all my thoughts and questions for now. Appreciate the time.
Thank you. And the speakers list that I have is Councillor Farr, Partridge, Pauls, and Whitehead. Councillor Farr.
Just with that last point, Deputy Mayor Fred also brought it up. I brought it up several hours ago in open session. So just to be clear on that, you have, as chair said, we'll deal with options above and beyond what Clerk Paparella has put on. As we came out, she had put on an amendment that takes away some language from recommendation A with respect to council to quote Mayor Fred, participating as fully as possible under the law, end quote. And so we'll have not only that amendment put up, but I heard Clerk Paparella say a couple of options. So that referral that Councillor Danko just spoke to, sound stuff that I believe will be part of that. I'll wait until that happens. You say you want to do that in just a bit. So my only other question, and I'll ask Jeanette Smith, our city manager, in a nutshell, this is a policy, all policies with the city of Hamilton Corporation created in tandem with work from councilors and senior staff, or even from senior staff as recommendations over the years to us, are subject to amendments, correct?
City manager.
Through the deputy mayor, I would say it is good administrative practice that all policies should be reviewed on a regular basis and to see if updates are needed. And there are times when situations change that also cause the senior leadership team to review policies and change them.
Thank you. Councillor?
I believe such is the case here. And I appreciate the time. And yeah, I'll go back on when Clerk Paparella puts up the options above and beyond the amendments of taking the wordage out of recommendation A at the appropriate time. Thanks.
After all our hard work today, she might get promoted to Councillor Paparella. You never know. Okay, so Councillor Partridge is up. Councillor Paparella shaking her head vigorously. No. Councillor Partridge, I'm all yours. Thank you.
Yes, thank you, Deputy Mayor Clark. And I agree 100% with the previous speakers, the mayor, and certainly Councillor Danko and Farr. We as a council need to lead by example, and to have any verbiage around us being exempt, I think that would be taken very, very poorly. It just flies in the face of our residents. So, but I just, for clarity, sir, am I hearing that Councillor Paparella, Clerk Paparella, is going to put some of that verbiage into the amendment that she's doing? Is because I want to be sure that I understood that clearly.
Yes.
That's what I heard.
We have a suggested verbiage coming forward, but that may change once the councillors have an opportunity to review it. So that'll happen shortly.
All right. Thank you, sir. As long as that's going to be included, then yeah, thank you.
Councillor Pauls.
Thank you. And through the chair, dealing with, first of all, with saying that the counselors are all vaccinated. We already declared it 5 months ago. We already stated it. And I think it's just we want to show gesture that we are, we're included. Public already knows right away. We had media call us, are you vaccinated? We were clear right from the beginning. We showed leadership. So from my point of view, it is unnecessary. But if council wants to gesture to say we're part of this, I'll go with it. But in my opinion, we've already declared, everybody already knows that we are all vaccinated. Anyways, that's my opinion on that. Second of all, I want to ask Dr. Richardson, what percentage, Dr. Richardson there? I would just want to ask what percentage of Hamiltonians are vaccinated?
Doctor?
Thanks very much to the chair. I'm actually just editing a PowerPoint on that subject, so I've got the numbers here.
How timely.
As of as of the end of last week, we were sitting at 85% of our total eligible population and 88.8% of our 12 plus population. I can tell you that's over 89.1% now. Had at least one dose, and 86.2% of our 12 plus population had 2 doses of vaccine. Our 3rd dose boosters are coming up, and I believe in the eligible, we're sitting around 45%, 46% of those that are eligible to date.
So do you consider that a great rate? Are you pleased with that?
Through you, Mr. Chair, I consider it a very good rate. I think what we would like to see as overall coverage is for those numbers to continue to go up, particularly in our pediatric population, where we're sitting at rates of between the 5 to 11 group in the 40% range. I think as well, we still have ongoing work that we do in building trust in parts of our community that are more challenged in taking up the vaccine. So there is certainly more work to continue to do, but pleased that we're at the point we're at.
I just want to ask you, we have a 93% in our city that are vaccinated. 93 is pretty good. We only have 7% that are testing themselves, and some are unpaid, I think 64. In your opinion, whether or not we implement this, Doctor, will the spread stop? Will it stop Omicron?
Through you, Mr. Chair, in terms of transmission of Omicron, as we've talked about already today, the vaccine itself does not stop transmission of Omicron. It can help reduce transmission and slow it. And so we do still think that vaccination is a key part of that. But particularly when it comes to Omicron, the major impact we're seeing is on severity of disease and hence absenteeism and other impacts that it may have.
Thank you.
And we all, yes, thank you. I'm just questioning the testing that we're doing. I hear that they're not reliable, or, so we're changing our policies now from before you could get tested. If you're negative, you're fine. Now we're saying that, of course, we're implementing this, that you might be, that you will be terminated by May 31st. I'm just wondering, what can someone do to say themselves that they could get tested on their own and be sure they don't have COVID and come into work? Is there anything else they can do instead of termination? Like, is there an avenue that they could take?
Dr. Richardson.
Through you, Mr. Deputy Mayor, in terms of being sure, no, there is no avenue that anyone can take in terms of being sure that they are not vaccinated against, because we do know that even with the tests that can be used, and the PCR test is a more accurate test than the RAT test in terms of detecting COVID-19. But even still, it takes a few days once one is infected with the virus for that test to become positive. And we do know that people can start shedding the virus and transmitting it to others a couple of days before they become symptomatic in terms of its use. As well, just while we're speaking of testing in terms of the RAT component of it, so that's the rapid antigen tests that aren't as accurate as the PCR tests are. Those tests aren't as accurate, particularly when there's low levels of virus that are circulating. When there's higher levels of virus circulating, they do better. But we would also recommend, from a public health standpoint, given the prevalence, that if we were to be using testing as a way of understanding transmission, then we would be using testing at a higher frequency than we had been doing. And so when we look at the guidance that the science table has looked at, we're looking more at 3+ tests per week when we're at this level of transmission in our community.
Thank you. Councillor, you have 1 minute left.
Okay, thank you, through the chair. I just wanted to be clear that if even if we implement this, people will get infected, whether they are tripled, doubled, or single. So my understanding is how we could mitigate, how we could help the 7% that are not vaccinated, because either way, we have to be careful. And that's what I'm struggling. I'm struggling with that issue. If I was guaranteed that everybody, 100% of Canada or 100% of our city is vaccinated, that the Omicron or Delta would disappear, I'd be the first one to say, let's go for it. But because it's a moving target for me, I really have a hard time to understand it. So thank you for your answer. I know, and we all know vaccination works and we should all get vaccinated. I'm not against that, but I just really am concerned about our policy, especially when we know that the province is responsible for this. And I think we should, rely on them and let them make the mandate. Thank you.
Thank you, Councillor. Next speaker is Councillor Whitehead, please. Councillor Whitehead. Your microphone is off, sir. We can't hear you.
Is that good?
Yes, it is. I'll start the timer now. Thank you.
Thank you. I just want to start by saying that anyone that doesn't get a vaccine, they're gambling with their own life. That's the reality. So I am a big, huge supporter of voluntarily getting a vaccine. But when it comes to public policy, there better be a damn good reason to mandate it. And I've been struggling with this because I have a virologist, so I have direct access to someone that better understands this issue than most. And he described it to me as going for a vaccine for, say, a flu type A. But it was flu type B that wiped through the community. It didn't really help. So I'm trying to understand. He described this vaccine as more of a therapeutic than a vaccine. And I thought that was interesting. And he said, it will help you survive. There's no question about that. But vaccines act differently. And I'm trying to understand when that's called into question, how can we be in as a public policy? I see our role as preventing the spread of something. Absolutely mandate whatever we need to do to protect people. But I also understand that with these vaccines that are taking place, they're not targeted to the specific strain that is running amok. And the reason I ask this question, I want to make it clear. I'm only raising it because I believe, and I always have when I got on council, that we have to 360 these discussions. We can't have a discussion, say everyone jump on board because it sounds like the old boys club already made their mind up. So I'm not asking it to because I'm trying to undermine it, because I'm supporting it. But I am asking because it needs to be asked. It needs to be asked in the context of all those people out there asking the same question to themselves every day. So the question is to Dr. Richardson, what is the prevalence of COVID-19 right now?
Thank you. Dr. Richardson, please.
Strain.
Dr. Richardson? No, can't hear you.
Sorry, struggling with my mic today. Through you, Mr. Deputy Mayor. Councillor, was there an end to that question? I think I might have missed the end to the question.
Well, I'm asking the vaccines were developed on the pretext of the COVID-19 strain. So the vaccines that everybody's getting, although the core of the vaccine prevents death, and that's why I say you should get the vaccines. There's no question anyone's being stupid if they don't. But having said that, I'm trying to approach this from a public policy point of view. So COVID-19, did it get wiped out by Delta? Like, how does that work?
Thank you very much. Through you, Mr. Deputy Mayor. So when it comes to COVID-19, what we're seeing is that different variants emerge as the virus continues to be transmitted. And we know that happens with viruses in general, that they continue to mutate, they continue to evolve over time. And so we are seeing different strains become dominant at different periods in time. So what is referred to as wild type, or the original strain, and then the alpha variant, and the delta variant, and now the Omicron variant coming forward. And so the vaccines that are being developed, as you said, Counselor, against COVID-19 as a virus, a more generic virus. And then we're looking to see globally as to how well they work against each of the variants, and looking to see if some will do better against some variants, some will do not as well against different variants. And so there's parallel research that continues to go on around how the vaccine can continue to improve to address emerging variants or a breadth of variants as we go. So right now we saw better protection against Delta in some ways, but still very good protection against severity and death with the existing vaccines against Omicron.
So what do you think about the comparison that my virologist made in the context of the flu shot? So you're trying to prevent, you're older person, you're vulnerable, you get a flu shot for, say, type A. But that particular year, you read it wrong, and type B wipes through the community. And obviously, you're not protected. So help me understand why that analogy is not relative to our current situation.
Doctor?
Through you, Mr. Deputy Mayor. So I understand from how you're framing it from your virologist that essentially he's talking about how the influenza virus, again, has many different types and strains that come through. And each year globally, the scientific and research community works to produce new vaccines that address the predominant strains that are coming through at any given point in time. Sometimes those matches are better than others because the virus will continue to evolve as things happen. So that is very similar to what we are seeing with Omicron in terms of developing a vaccine that matches the current strains and the projections of what we see going forward. And over time, as I was describing, they're going to continue to monitor and see how good that match is between the vaccine and the currently circulating strains. What I would say is a bit different than what your virologist described is there's a significant difference between type A and type B influenza strains. There is not the same degree of difference between the Delta and Omicron strains in terms of the vaccine's effectiveness right now. We're still seeing significant impact of these vaccines in terms of severity and death against the Omicron strain.
So help me understand. Help me in Africa, where this first broke out, and they had low participation on vaccines. They declared that the Omni wasn't as much more viral load, but it was less serious than the previous strain. So my point is, if their stats show that a lot of people not vaccinated really didn't develop any more serious ailment than the ones were vaccinated in Africa, then how can you make a different finding here?
Doctor?
Mr. Deputy Mayor, when it comes to comparisons globally, it is very important that we look at all of the evidence as it comes forward in the experience. And in this case, Canada is at that leading edge of the wave. The evidence that's come from South Africa came from very early days, and there's been further information that's come from Denmark, the UK, Germany, all around the world in terms of Omicron and how it works. And so the generalizability too of the South African data to the Canadian data, the circumstances are very different. They have a younger population. They have a population that's had a significant number of cases compared to what we've experienced here in Canada, fortunately, because we have the vaccine. And so there is, you can't really generalize what happened in South Africa to what is happening and what we might expect to happen here in Canada. And so that's why there's a lot of caution put on that and why we look to other countries that are more similar to ours. I would just note though that, this is, the evolution of variants and the issue of vaccine equity globally are very, very important, both in terms of just the sheer impacts that are happening to our people around the world, but also in terms of our own interests, in terms of the evolution of different strains, if it continues to circulate at the rate it's doing.
Thank you. Councillor, you have 1 minute, 39 seconds left.
Thank you. I really appreciate the answers. I approach this from a public policy point of view, and I see that more people will get vaccines when they're not mandated, more receptiveness to it. But when it starts getting mandated, there better be a damn good reason, and that vaccine better target the very thing that you're worried about, and that's the challenge, and that's what we need to have this conversation. I'm not raising the conversation because I say don't get the vaccine. Get the vaccine. I'm not doing it because I say don't mandate. Obviously, predominance in thought around senior administration is that it's better to mandate it. That's a conversation we'll have and review. But for now, I think that if you want to build confidence in the anti-vaxxers or any of those people that have doubts, then you need to have a full conversation, just as I sort of presented, not to undermine what we're doing, because we need to do what we're doing, but to have them understand that we're anticipating and appreciating those concerns, and those concerns are being weighed in the context of informing us and having the conversation. By just saying, hey, everyone jump on board and vote for this, and so show our support and our leadership, and not having that conversation is a disservice to this community. So I always will approach every issue on a 360. Thank you very much, Mr. Chair.
Thank you, sir. You're 5 seconds short. Well done, sir. Next speaker is Councillor Tom Jackson.
Thanks, Deputy Mayor Clark. So I'd like to just pick up where I left off before we went in camera with Executive Director Fontana, please. And forgive me if a couple of my points are repetitive, but in light of the full discussion we've had in both sessions, I think it's important to just reaffirm so that I'm clear. Through you to Executive Director Fontana, Laura, the change and the amendment proposed in this policy is primarily focusing on the 474 employees that currently have been doing what we've allowed them to do in the current policy to get rapid tested to maintain their employment, but to, with whatever we're calling it, moving parts in society, Omicron taking over from Delta, the target is the 474 to hopefully nudge them closer to getting vaccinated. Through you, Deputy Mayor Clark, please, just to make sure I'm perfectly clear on why we're even in this discussion today.
Thank you. E.D. Fontana.
Through you, Mr. Deputy Mayor, to the councillor. So yes, it is targeting those 474 employees that are currently participating in the rapid testing program. I would also suggest that it's also targeting the other 68 employees that are not participating in the rapid testing program, so that they understand what the implications are if we continue to be in non-compliance with the policy, and what that'll eventually mean in terms of their employment with the city.
And to be clear, the 68 are on unpaid leave, and they're very much made that decision on their own in light of the policy last fall we passed. Through you, Deputy Mayor Clark, is that correct?
Thank you.
E.D. Fontana?
Thank you. E.D. Fontana.
Yes, through you, Mr. Deputy Mayor. Yes, that's correct.
E.D. Fontana, I remember last year when I supported going forward in this policy, and given the accommodation of the rapid testing option, you mentioned an educational program, trying to sit down with every individual that for whatever personal reason, and I'm not talking about the rabid protesters at all, but talking about individuals who just, for whatever reason, had personal medical concerns about their own bodies and getting the vaccination, but very proud of being employees. Did those educational sessions one-on-one, did they occur? And can you, without getting into privacy matters, give us some indication what the feedback was? Through you, Deputy Mayor Clark, please.
Thank you. Ms. Fontana.
So through you, Mr. Deputy Mayor, yes, indeed, we did actually develop an education session for employees across the organization. primarily targeting those that are either unvaccinated or didn't disclose their vaccination status. I'm sad to say that not many of them took advantage of the education session. We had limited number of employees. I don't have the exact number, Counselor, but there was not a huge uptake in the employees participating in the program. We did not pursue it any further. We made it available. It was certainly part of our journey in terms of helping folks understand the benefits of the vaccination, as well as the, as we slowly introduce the policy and the rapid testing program. But I can tell you that we didn't get the uptake that we had hoped. Those that participated filled out the attestation form and submitted it, so we did have a record of it. But we didn't get the response, the positive response that we wanted to any large extent. But we did make the program available. It's still available if folks want to review and participate in the program, but it wasn't as well received as we had hoped.
Thank you, Councillor.
Yeah, thanks, Deputy Mayor Clark. Very interesting and obviously somewhat disappointing that I was hoping you could have given us a larger measure of some of the reasons and the feedback you got from a larger participatory group of the 474 going through the classroom session as to what their main feelings were and wanting to just be part of the rapid testing program instead. A couple more questions, Deputy Mayor Clark. Edie Fontana, a couple of my colleagues want to go in the direction of changing the 474 to unpaid leave. I am more inclined to support HR's recommendation that they would be paid leave. Can you explain why you've recommended that instead? Through you, Deputy Mayor.
Ms. Fontana.
So through you, Deputy Mayor, the reason for the notice period and to provide a paid notice period is to allow the employees the opportunity to get vaccinated. We are obviously introducing a fundamental change in our vaccination policy, and in order to give them that opportunity, they shouldn't be adversely affected. We are making that change, and we certainly want to give employees ample notice to get vaccinated. So at this point, I believe there's a 20-day waiting period between vaccinations, but of course, we want to give employees ample opportunity to get vaccinated and comply with the policy. And during this time, we don't feel that they should be adversely affected by this change in policy. So we are recommending that employees continue to get paid during this next 4.5 months so that they can, make their decisions, hopefully get vaccinated, and continue being employed with the city.
I would, I strongly support where HR has landed from that standpoint. I know there's a few of my colleagues that may have contrary opinion, which I respect. But in light of the change in employment and the next 4.5 months, I'm very supportive of them continuing to be paid as valuable employees of our corporation. Last question, Deputy Mayor Clark, through you to Edie Fontana. Laura, have you heard at all, other than other municipalities we've been shared with that have already gone down this path of a termination plan and it's been activated across your provincial network? Have you heard of any position changing with the provincial government overall? Question A. Question B, if not, or if you have, question B, if they were to move from their current position, either provincially mandated termination and or overriding municipal termination policies over the next 4.5 months, we could easily then, council could, if it wished to, change whatever we do today, and you would bring those that information and recommendation back to this committee. That's my last question, Deputy Mayor Clark.
Thank you. Ms. Fontana.
So through you, Mr. Deputy Mayor, so at this point in time, we haven't received any indications from the province to mandate any legislation supporting mandating vaccination of employees. And in fact, there doesn't seem to be any support for such legislation. But I would assure you that if there is a legislation that we would change or have certainly an impact on the policy and what we're recommending today, that we would indeed bring that back to council and make those recommendations accordingly. If there are, I would suggest legislation would trump our policies and our collective agreements, and we would need to abide by provincially mandated legislation. But notwithstanding, if there were any significant changes, we would certainly be bringing those before council for recommendation and approval.
Thank you for all your responses, Executive Director Fontana. Thanks, Deputy Mayor Clark.
My pleasure, sir. Thank you. Councillor Wilson, you're up next, please. Then there's Councillor Nan, and then I'll put myself down as a first-time speaker.
Thank you, Deputy Mayor. I was going to ask Dr. Richardson to speak to the rapid antigen tests and the emerging, I think she confirmed concerns, sorry, can't think of the word, about their reliability. And I thought I heard you say, Dr. Richardson, that at this point we'd probably be looking at 3+ tests per week. Could you just speak to that? And then I think it's set out in Appendix A. My second question would be, I can't find it at the moment, but the policy for the City of Hamilton, does it automatically move to the 3.5 tests or 4 tests per week as opposed to the Monday and the Thursday? Thank you.
Doctor?
Through you, Mr. Deputy Mayor. So thank you, Councillor. That's a great question and opportunity to just go over that piece one more time. The RAT tests that are out there, as I was mentioning, their ability to be clear in terms of what they're detecting depends on how much virus is out there in the community. And so when there's low levels of virus, you're going to have more concerns about the results that you're getting than when there's high levels of the virus. So when there's low levels of the virus, if it's positive, it may or may not be Omicron. When there's high levels of virus, those positives are going to be Omicron. And that's why the shift in the provincial guidance to say you really don't need to get the RAT tests confirmed by PCR when we're dealing with the situation that we're dealing with. If you're sick with symptoms that are consistent, you do an RAT test and it shows that it is, you've got it. There's a very low likelihood that you don't actually have it. So that is the piece about the reliability. They're actually better now than ever. So the reason for shifting though from once or twice a week testing to 3+ relates to the level of disease there is in the community. So with so much disease in the community and the transmission being high, then you're really going to want to make sure you're testing often because people are getting exposed more often. They're more likely to get sick. And so you want to be testing more often to pick it up and to reduce the likelihood that people are whether we're talking about long-term care homes or wherever it may be here at work, to reduce the likelihood that they're at work and are sick. So that's the reason why we increase the frequency of testing based on how much COVID there is out in the community. In terms of the policy per se, I would turn that over to Laura.
Ms. Fontana?
So my apologies, Mr. Deputy Mayor. I would require the question to be repeated.
Thank you. Councillor?
No problem. I was asking Dr. Richardson to just clarify her remarks on the rapid antigen tests and her comment about the time and place of shifting to 3+ tests per week. And given that we have this is brought to our attention because we're in a supply issue, the ability of the city policy to shift from the Monday and the Thursday to this practice would assume we would burn through that limited supply even more quickly. And does the policy allow for that flexibility?
So through you, Mr. Deputy Mayor, the policy currently refers to twice weekly, but that was one of the impetus for us bringing back the policy to council. It was the limited supply and our ability to, have assurance that the testing program that we are undertaking was effective. So, and the advice was from public health, and to Dr. Richardson's point, that twice weekly isn't sufficient and is not going to provide for the protection that's needed in our workforce. So that, in light of the limited supply, caused us to review our current situation and make more difficult decisions as to the rapid testing program.
So just a supplementary on that, Deputy Mayor, from what you've just said, then Executive Director Fontana, are you shifting to more frequent test requirements, or you're leaving it because of the dominance of this supply issue? Thank you.
So yes, through the deputy mayor, we're leaving it primarily through because of the supply, and plus, and I would say even primarily because of the concern of the efficacy of the tests in terms of testing twice per week. We don't have an alternative, quite frankly, to go to 3 times a week or greater. A supply issue, a resource issue, we would have to revisit and deal with resource issues with staffing. But we don't have that level of comfort in terms of even 3 times a week. And where does it end? Now it's 3 times. Do we go to 4 times? It's becoming more and more problematic, and it's reaching a point that it's just not. It's untenable for us to continue.
Thank you. On page 7 of the public report, Executive Director, it's in the context of the supply issue, and it states, should supply issues become ongoing and unresolvable, the city will make future recommendations as to how to address such circumstances. Is it fair for me to ask you what that means?
So through you, Mr. Deputy Mayor, the reference there, we're receiving assurances that we will receive ample supply to carry us through until the end of May. We're working currently with private vendors. We haven't heard back from the province, as I previously mentioned. That reference is really if we are in a very untenable position that we don't have rapid tests, like it's simply dried out, and it's rendering our policy unmanageable going until the end of May. Then we would have to come back to council and at least get some further direction. But at this point, we're confident that we will have the supply till the end of May, and we don't foresee any significant shortage that would severely hamper our ability to continue with the rapid testing program.
Thank you.
Is that it, Councillor? Thank you. Next speaker is Councillor Nan, please.
Thank you. Through you, Deputy Mayor. Just reviewing both the public report and the appendix that has the policy that's attached to the report. I believe it's Appendix A. And under Appendix A at the bottom of page 2 and the top of page 3, the scope of the policy already states that the policy applies to all employees of the City of Hamilton, including full-time, part-time, permanent, temporary, casual, volunteer, and students, including members of council and members of council appointee committees. New employees will also be subject to this policy as a condition of their employment contract with the City of Hamilton. So in terms of the amendment that some of my colleagues were looking to make sure it was integrated, it seems like the draft scope, the appendix already speaks to the scope that this council is looking to move forward with. So I think that language is appropriate. I also appreciate staff taking the time and the diligence to put together what looks like a very reasonable, fair policy here in terms of mandatory vaccine verification. The timeline of May 31st seems generous on one level, but also very, very doable in terms of supporting those remaining employees who have yet to opt into vaccination to be able to do so safely and within the public health guidelines of 28 days between the doses. So all things considered, and given the number of questions that have already been answered, just my thanks to staff for bringing forward these recommendations. I think it's fair, and I'll definitely be supporting the recommendations here with the amendment to not exclude council members. Thank you.
Thank you, Councillor. Councillor Jackson, could you take the chair, please?
Councillor, the floor is yours.
Thank you. So just some quick comments. I guess I'm incredibly frustrated that municipalities across this province are having to become innovative and creative with legislation to ensure the occupational health and safety of our employees and our residents. It bothers me that there is legislation, the Healthcare Consent Act, that very clearly stipulates a need for informed consent before you agree as a resident of Ontario to receive any medical treatment. And that, for all intents and purposes, has been flushed by the province of Ontario with regards to these vaccinations. They dealt with their employees at the Legislative Assembly, and they left the rest of the province, both employers in the private sector and employers in the MUSH sector, to their own devices to come up with how they're going to move forward. So for me, that is incredibly frustrating. I know we very clearly, when we dealt with this 5 months ago, roughly 5 months ago, we indicated, because we asked Ms. Fontana a number of times about the termination of employees. And it was clear to me that the discipline of employees would only be if they refused the education process and if they refused the testing process. And at that point, they would be subject to discipline that may, in fact, have included termination. While I understand the rationale, it doesn't make it feel any better to employees out there who were told 5 months ago that we're not going to be terminating our employees as long as these things occur. And then we find this new switch that the number of the antigen tests are in dispute. You can't get them. You can't find them. You can't buy them. And so what I understand from Ms. Fontana is we have sufficient supply to last until May 31st. Did I hear that correctly? If I could just get that confirmation, Mr. Chair. I think that's what I heard, but I could have been mistaken.
I think so too, but Executive Director?
So through the chair to Councillor Clark, we have assurance that we can have a test available until the end of February. We are continuing to work with the vendors and have also hopes of continuing to receive a supply from the province. We're very hopeful, but at this point in time, we don't have any guarantees that we have an adequate supply until the end of May. Right now, we've secured something to the end of February, and we're very, very hopeful and optimistic that we will secure a supply until the end of May.
And I understand, as Councillor Jackson, thank you for that, Ms. Fontana. I understand, as Councillor Jackson has indicated, it would be unfair of the municipality to say to their employees, we have required you to be tested, but notwithstanding the fact that there are no tests available, we're going to terminate you or in essence lay you off. And so what the language says is it would be a paid leave if we didn't have the tests, which I think is a reasonable response that would be upheld by the courts. I don't know where this is all going to fly. I don't think any of us really can predict with any degree of certainty where the courts are going to go. I am comforted in knowing that the few grievance decisions that I have seen about the issue of mandatory vaccination declaration, and if you don't participate with that, you have to be educated with some type of process and commit yourself to tests, that was held to be reasonable by the adjudicators, which I think really bodes well that what we are doing, while some would declare it to be more draconian, I would say that in the interest of occupational health and safety, we are making the right decisions with the right balance to ensure reasonableness. And that's going to be the test in the courts. So I'm uncomfortable with the language in A, and we're going to have that discussion very, very shortly, because we're not exempted. As it's been indicated by my colleagues, most of us around this table have had 3 shots. Some of us have only had 2, but it's very clearly council has been on side with this from the get-go. So we may need to parse that language out there. The rest of the policy, while I feel uncomfortable at some point that we're going to be in a situation where we may have to terminate employees, we have been reasonable with employees, given them lots of time to learn about the vaccine, to maintain their employment with this municipality. And should they decide at the end of the day that they're not going to cooperate with us on such a crucial occupational health and safety issue as this one, then it would be reasonable at some point in time in the future that the municipality would sever the contract with them. So those are all my comments. I'll take the floor back. We have 2 second-time speakers, and then we're going to quickly go to that amendment in A so that we can resolve all of this right now.
No,
Councillor Whitehead,
Clark,
you're
no,
second.
Councillor Clark, you had the floor.
Sorry.
You had the floor. I'm giving the chair back to you. Thank you.
It's been a long day, Councillor Jackson. Thank you for your help today, by the way, very helpful. So now I do have the chair back. Councillor Whitehead, you have the floor, sir.
Thank you, Mr. Chair. Just a technical issue. Maybe Stephanie can straighten it out. I must be doing something wrong, Mr. Chair, because I put a request in, I don't get any acknowledgements or confirmation.
What type of request are you putting in, sir?
For task questions. Task questions.
Oh, to ask questions here?
Yes. Yes. And then I look at the thread, where I've asked very early, and a number of other speakers went forward. I don't have a problem with that. I just wondering if I'm doing something wrong in the system, or there's just something I'm unaware of.
The vast majority of speakers that I have acknowledged today have used the e-scribe to indicate that that's where they wish to speak. And I think you're one of the only ones that have actually put it up in the chat. Because the e-scribe is working, I have not been paying attention to the chat line, respectfully. However, Mr. Gauthier, who is our legislative clerk, has been paying attention to chat as well as e-scribe and has kept the speakers list up to date for me.
That's fair, and I just wish that they actually confirm that I'm going on the speakers list, because I don't get any confirmation, so I'm left in a cloud trying to figure out, am I on or am I off, until I actually see it put up.
Periodically, if you look at the chat line, you will see it says speakers list, Wilson, Nan, Clark, Mayor, second time, and then it has the next time round, and it has Whitehead second time. So you are on there. Go ahead, sir.
Fair enough. Thank you.
Start your 5 o'clock, your 5 minutes over, just because I'm a nice guy.
Thank you. I'm trying to figure out from a public policy point of view, if you're going to mandate something, obviously you're trying to prevent the spread of something. My understanding is, well, maybe it shouldn't be my understanding, it's the doctor's understanding. So Dr. Richardson, I've been doing a lot of reading on this, and what I'm seeing, and it's not from the internet either, from medical journals, asking questions of my own doctor. The question I have for you is, they're saying the Omni strain is cutting through the current vaccines like a hot knife through butter. Do you object to that? Their view of that?
Doctor, you may have a different metaphor, but please answer the question.
Through you, Mr. Deputy Mayor, as I was saying earlier in the meeting, when it comes to Omicron, it is not, the vaccine is not as effective in terms of preventing transmission, but it continues to be very effective in preventing severe disease and death. So I wouldn't use any sort of analogy such as that. I'd prefer to just speak to the specific description that I've given you.
Thank you.
Yeah, so I'm just trying to understand the public policy. Sorry, sir, go ahead.
Go ahead, Councillor, you have the floor.
Okay, through the chair. So help me understand, what is the public policy piece? If we're going to force someone to put something into their body as opposed to voluntarily do it, and there's a public interest, and we know that this vaccine has not stopped the spread. We know that mask hasn't stopped this spread, but people could argue that it would be worse if we didn't do it. It's fair enough. Where's the public policy piece if these vaccines aren't stopping any spread? So who are they putting at risk when they come to work?
Dr. Richardson? I should remind everyone that Dr. Richardson has a meeting at 4:30 with the province, which is essential that she get to. But go ahead, Doctor.
Through you, thank you, Mr. Deputy Mayor. In terms of the vaccines, they are meant to absolutely protect those who are vaccinated against severe disease and hospitalization and death. And so that is one of the principal means in terms of protecting people that we have. In terms of transmission, there is some evidence that they do reduce the risk of transmission as well. And so that is part of their role. It is not what it was with Delta, but there is still some evidence of reducing transmission.
Thank you.
I appreciate the answer. The reason I ask is this will be reviewed at some point in time in history to determine if it was a great policy effort. But it is concerned because it could be the slippery slope. Because if we're going to start mandating and people lose their jobs because they don't necessarily want to take a vaccine that isn't targeted to the actual illness and it's not stopping or preventing the actual spread, it might be slowing it down. There's no evidence yet. That evidence will come out over time. But the concern I have is people going to lose their jobs. And that's something I just can't support because it's not doing, this vaccine isn't doing what most vaccines do, and that is preventing the spread. So that's the one point I wanted to make. The other is that, I had a vaccine back, I think it was April, the first one. And then I went through my health issue and my virologist basically said I couldn't get the vaccine, the second shot, because my immune system, everything was shot. And I had to wait till I think it was September for the second shot. But I can tell you that I couldn't go anywhere or do anything without that second shot. So there are people, and they didn't accept the medical certification. Basically, I couldn't do it. So help me understand those that have legitimate and bona fide reasons for not getting a second shot, like I was in that time frame. And it's not because I didn't want the shot. I think anyone that doesn't get the shot is just fooling themselves. Why are people that are in earnest and good faith want to get the shot and can't for good reasons? Who is the judge, jury, and God to make that decision?
Dr. Richardson? Or Ms. Fontana? Not really sure who to answer that one.
Perhaps I'll start. So through you, Mr. Deputy Mayor, in terms of the policy, if there is an approved medical exemption, the employees then are exempt from the policy. They won't be subject to termination. They'll likely continue to be subject to testing, but they would not be subject to the termination provisions.
So what would that conceal? We see a doctor slip didn't get accepted. So help me understand the context in which you mean when you say a medical exemption, because I have a letter basically during that period of time and it wasn't accepted.
Accepted by whom, Councillor Whitehead?
Well, I had it. So if I want to go to a restaurant or whatever, I couldn't because I didn't have both shots. And the exemption they said that exemption isn't covered.
Okay, so that's separate from the policy that we're talking about here.
Yeah, but again, there's people out there with legitimate. Mine was just timing. I had to wait till my immune system had built up. The point is, you don't introduce something new to a system if your system can't take it. So I'm trying to understand when you say medical information, to what degree? Like just to say this patient is under my care and for the time being cannot take the vaccination. Is that good enough, or do you need more information?
Ms. Fontana?
Yes, through you, Mr. Deputy Mayor, we would review each case on its own merits. We would review the medical documentation. We would consult with the occupational health nurse, and we would make a decision from there. But generally speaking, if we have medical documentation that supports an employee is not able to receive the vaccine, we would generally accept that information.
So the letter that I described would be.
Pause. Sorry, Councillor, 1 second. I heard someone say, if I may.
Thank you, Mr. Deputy Mayor. If I may to add to that, what Laura has said, I just want to make that distinction that Laura is making between policy and what the process is for the public. And so that is absolutely the policy route. When it comes to the public, there is a route for people to go to have medical exemptions done by their physician. Those are sent to public health, and public health then enters them in so that people can get QR codes. So just wanted to clarify there are two different processes for those two things.
And that's good for everyone that's listening. So these things, this is informative when I ask these questions, because there's many people out there asking those very questions of me and my own experiences. So thank you.
You have 1 minute left on your second time. Thank you.
Well, I thought those questions need to be asked, Mr. Chair. I think that, again, I'm going to reinforce this. Part of our role is to ensure that that everyone feels part of the community, and even those that may be activists or maybe out on the edge, other edges. Doesn't mean that every once in a while they're asking legitimate questions and concerns. And I see my role partly is making sure I raise it here in this forum. So not only when you get the answers, they're being informed, but they also know that we're taking all this information, every piece of it. We're not ignoring anything. And we're making informed decisions on the 360, not just on a direction from bureaucracy. Thank you.
Thank you. And I think all of your colleagues agree with you. That's how they make their decisions as we move forward. Councillor Pauls, you're the second time speaker, and then we're going to go to the amendment.
And I won't take long, and thank you through the chair. I just want to ask Laura Fontaine a question. We are changing this policy, and mainly I heard it's because we don't have testing. We're short of supplies. If we weren't, maybe we would have stayed with that policy. If they get tested, they make sure they don't have it, they come into work. And my concern is because when I look at the people that are important in our 911, it's so important, like the fire department, paramedics, the officer of health, and all that. Those are important people. I'm just wondering, why can't, if it could be possible, why can't people themselves go to a lab, pay the money? I think you could go to Shoppers for $40 and get tested. They pay for it. The city has no responsibility. They have to prove that they don't have COVID and go to work. I know because I needed to have a PCR. I paid $175, but I wanted to make sure I didn't have it, and I paid for it. Why couldn't we go to that route until we know what the province wants to do? I still believe that the province has a big role here. I really do, and the federal, they have a role to play, and we're dealing with people's life. I feel for them. I feel for someone that calls me and say, I'm going to lose my job, and I don't know the reasons. I don't even want to ask the reason why they don't get vaccinated. But if we could let them do the test, pay for the test, it's up to them. If they don't have the test, they don't get paid. Can we go that route?
Thank you, Councillor. Ms. Fontana.
So through you, Mr. Deputy Mayor, first I want to just clarify the councillor's initial comment about the impetus for changing this policy. And Councillor, it was not the lack of tests necessarily. It certainly was a consideration and a factor for our review. But one of the other main factors or considerations was the concern with the efficacy, and that the frequency of the test may not be rendering the results that we're looking for. Testing twice a week may not, protect our employees, may not provide us with the information that we need. We heard from Dr. Richardson that in our community we're looking at least 3 times a week, so that was problematic, and that coupled with the fact that we don't have a adequate supply or a reliable supply going forward, that was also a main consideration. But to your question in terms of having others, provide their own tests and submit it, and we did include that as an alternative in our report. And we do have concerns that receiving a test from an unknown manufacturer or source, we wouldn't necessarily have the confidence in terms of the test results that we're receiving. We don't know the nature of the test. We don't know if it's an effective test. There were a lot of issues that were associated with that if we didn't sort of have, at least an understanding of the source of the rapid tests and how it's the validity and the reliability of the test results that we would be receiving. So for those reasons, we didn't recommend that alternative.
I
Thank you,
don't know.
Councillor.
Yes, thank you. And I don't understand this because when I was away and I had to come back, I did a test, $175 I paid. It was a PCR test, government approved. Then I had to take another test with the government to make sure I was selected that I did not have COVID. And they told me what to do. So why can't we be sure that these tests are working? I mean, if I were to lose my job and I could pay maybe $150 a week or whatever, I would pay for that to keep my job. So I don't understand I find it kind of harsh. I think people should get vaccinated. I want it to be clear. Everybody knows I'm vaccinated. Everybody here's vaccinated, but their reasons, and I don't even ask them the reason. It's their personal view, their freedom, and I'm concerned about that. So why can't we say these are the tests we accept? You get them, you get tested, you pay for them, and then you will not be fired. And if you can't get them, then in May 31st, that's the end. Can we do something like that?
Thank you. That's the second time you've asked the question. So, Ms. Fontana, can we try to answer it?
So yes, so through you, Mr. Deputy Mayor. So I mean, again, it will put a strain on our supply, province-wide, citywide. I think Councillor Pauls, you're referring to PCR tests, which is different than the rapid test. We don't have a source for those PCR tests. Again, we would have to monitor and ensure that we had confidence in the reliability and the validity of those tests. It's arguable whether or not an employee should be paying for those tests if it's a requirement of their continued employment. These are all the factors that we have considered and decided against it because of the vulnerabilities associated with allowing employees to conduct their own test and provide us with the results.
Thank you for that answer, and I'm still battling on my decision because I just feel I feel torn. I feel torn what's going on, and thank you for that answer, and thank you again, Laura. You've been super all the time. I appreciate you. Thank you.
Thank you, Councillor. Councillor Powers, did you have a question, or are you trying to urge us to call the question?
No, I just got a question. Has the motion 10.8 been moved and seconded yet?
Yes, it has been moved and seconded, and now we're moving to discuss the amendment.
Then I would move to put the question.
Okay, you've moved to put the question, and you need a seconder to put the question. Mayor Eisenberger, all those in favor of putting the question, do we need to have an electronic vote for that, Madam Clerk? Nope. Anyone opposed to putting the question? Nobody is opposed.
Just a comment that we had suggested some additional language in item A.
Yep, I'm working on that, sir.
Can we put that up? And I'm as anxious to get to the final outcome here as Councillor Powers is, but I hope we can kind of resolve this language before we call the question and make the amendment as required.
Thank you, sir. And I wasn't going to call it until we tried to at least get it correct. So the proposed amendment is up before you. It's being proposed that after the word accept, we delete members of council and leave in members of council appointed committee. Was there any other language? Madam Clerk, go ahead.
Yes, through you, Mr. Deputy Mayor, there are two options. In speaking with Andrea, Andrea has advised as well that if you wish the council appointed committees and the boards and agencies to follow that, we would be better to go with an option 2, which would be to remove the save and accept members of council and members of council appointed committees, and then add that so that the city clerk be directed to report to the governance review subcommittee with recommendations for amendments to the council code of conduct and the code of conduct for local boards to ensure member compliance with the corporate vaccination policy and how sanctions may be applied to council members who do not comply. The first one applies only to removing council. So council appointed committees would still be exempt, but members of council would not. So those two options are before you. I'm not sure which way you want to go, but they're both there for you.
So, Madam Clerk, if we're wanting to use the latter language in terms of getting it to the code of conduct, that would be option 2.
Through Mr. Deputy Mayor, it would go to the code of conduct for both, but for option 1, it would be for the code of conduct for council only. Option 2 would be to change the code of conduct for council and the code of conduct for local boards.
Thank you. Mr. Mayor, you have the floor, sir.
Yeah, and I like option 2, although I'm not sure it completely spells out that it is members of council appointed committees or member of council or council appointed committees. I'm not sure it's in there, but that's certainly the direction that I'd like to move. Or Councilor Danko raised this, and I think more appropriately he could be the mover and seconder of this amendment, so that both council is adhering to a policy and there are potential sanctions, and council mandated committees are adhering to this policy, and there are sanctions, not necessarily removal, which we cannot do, but certainly only council can do that, but certainly sanctions that can be identified through the governance process and through the Integrity Commission.
Councillor Danko, you wish to move the amendment?
Happy to do that. Yeah, I agree. The second option that includes council and committees would be my preference.
Thank you. And to be fair, Mr. Mayor, I think Councillor Farr was also talking about this early on. So
Yep.
If Councillor Farr could second it, then we're all on the same page.
Okay.
Perfect. Councillor Farr will second it. Thank you, Mr. Mayor, for your assistance and advice throughout this meeting. Councillor Partridge, you have the floor.
Yeah, very quickly, I agree with option 2 as well. I think it is certainly clearer than option 1. And yeah, call the question. Thank you.
Thank you very much. So it is moved by Councillor Danko, seconded by Councillor Farr, the amendment. And we all know what the amendment is, and the clerk is just quickly trying to make sure that we've got the vote ready to go. Oh, make sure you're coming out of closed session. I was still in closed session. I'm in favor, Madam Clerk.
Okay. Councillor Whitehead, I'll mark you back in. If your vote doesn't come up, let me know and I'll pop you back. And Councillor Pearson,
Whitehead is thumbs up. Councillor Pearson is thumbs up. Anyone else?
Councillor Powers. Okay.
Councillor Powers is giving me the thumbs up with the cartoon little figure. Very cool. Modern technology, isn't it wonderful when it works? And that's carried 14-0. And now on the main motion as amended, same mover and seconder.
Through Mr. Deputy Mayor, Councillor Danko, I believe, wanted to vote on D separately.
Councillor Danko, did you wish to have division on item D, separation?
Please, thank you.
Thank you. So we're now going to have a separate vote on item D. Councillor Jackson, please.
Deputy Mayor Clark, just to be crystal clear, especially for those viewing in, D is about whether by May 31st, non-compliance of the 474 would be for paid leave or non-paid. Staff are recommending in D they be paid leave, correct? That's what we're voting on?
That is correct.
Thank you very much. Thank you.
Councillor Clark,
Up for me. It's not coming. I'll have to hit F5, I guess.
Councillor Whitehead, thumbs up. Thank you.
Yep.
And Councillor Pearson, I'm sorry. Thumbs up. Thank you. I tried to see all 4 of you at once, but my eyes only go one direction.
Councillor Whitehead, sorry, hang on. Councillor Whitehead is talking to me. I can't hear you.
For clarification, this is just to separate D out, or is this actually on D?
This is actually on D. You're voting on D.
and I support the pay, so I would support this now, right?
Yes, sir.
Thank you.
Okay, so that carries on a vote of 11-3. Moving on to the main motion as amended, unless they're missing something else. Nope,
Nope.
We're all set to go on the main motion as amended.
Yes, just give me one quick second to take D out. Just give me 1 second, folks, to show the, I'll do it that way.
And while that's happening, Madam Clerk, when we came out of in camera, there were no votes in camera. We just had in camera advice, correct?
Yes, but through you, Mr. Deputy Mayor, I still do need to get a vote to receive the report and to have it remain confidential.
Okay.
And I still need, Councillor Clark, are you thumbs up on the main
Yes.
motion as amended?
Yes, thank you.
Same, Councillor Powers, just give me a nod if you're good. I got, and Councillor Whitehead, you're okay too? Thank you, sir.
And that carries 13-1. And we need to deal with 14.2.
That the report remain confidential, or sorry, that the report be received and remain confidential.
Thank you.
You're welcome.
Moved by Councillor Powers and seconded by Councillor Whitehead. We're all good. Thank you.
Councillor, I already have a vote on that one.
Do we?
As we're voting, Mr. Chair, just a reminder that we have a special council meeting right after this to ratify this decision. Just to remind everyone not to disappear, and we'll get to it promptly.
Thank you. Madam Clerk, did we already cover that one off?
I do show a vote on that one,
Okay,
yes.
perfect. I thought we missed it somehow.
I did too.
Okay, so now we need a motion to adjourn this GIC, but as the mayor indicated, please stick around for the special council meeting, and you do have to go out of eScribe for GIC and come back into eScribe for the special council meeting. I need a motion moved by Mayor Eisenberger, seconded by Councillor Nan, to adjourn. Anyone opposed?
And we will need about 10 minutes or so between the two system, please and
thank you. So if we could do a nature break for 10 minutes. So 4:51. Thank you.
Okay.
Good job, Chair. Thank you, and we'll see you in 10 minutes.
Thank you.
Won't end it yet.
Do we have to leave? Oh, shoot.
You'll have to leave eScribe and WebEx and go into
Yes.
both new meetings, yes.
Thank you. Thank you. So we have to leave WebEx too.